How you doing today?
Sheila.
I'm fine. Still tired.
I got your text. I miss you.
Thank you. I miss y'all too. Look at you all, teefuses. No worries, Michelle. I'll be on my best behavior.
Ain't nobody worried about you. I know you're gonna be amazing.
You look pretty in that blue.
Thank you. This was a sweater I wore on Dr. Oz.
Oh, I'm talking about your head wrap.
Oh, I got this from. Okay, what is happening?
What?
It's not cooperating. I might have to just go live a different way. Let's try this again. We're gonna shut it down.
Don't shut me down because I barely got in here.
No, I'm not talking about that. I'm talking about going live streaming to Facebook. It's doing a thing. So let me see. Connect to Facebook. Okay. Let's try another way. Technical difficulties. Nope, that's not it. We're gonna get started shortly, everybody. Get a cup of tea, make yourself comfortable.
No, all right, I'm going to get my tea.
Don't take too long.
All right.
Yeah, so apparently the universe does not want me to go live on Facebook right now, so I'm just going to respect that. We're going to get started in about we're going to give people time to come in. So we're going to give it about 5 minutes as people pour in. It's funny, people, it's hard to tell people who aren't here that their the link is in their it's in their confirmation email. All right, let's see. I just got a message from somebody.
Then we got the email that said, if you're not coming, let me know. Because we have standby people.
Yeah, there's 50 people on the standby.
Mm-hmm.
But I'm having to, I need an assistant.
Oh, man.
I see.
I thought you just sent that to me. I said, don't threaten me.
No, I sent that to everybody. But you know, people, there's lots of things that happen where people don't realize it was in their confirmation. They don't read the confirmation email, or their confirmation email may have gone to their spam box for some reason. Although, however, they should have gotten it even, well, I don't know. It's tricky because all right. So we're just bringing people in. Thanks for your message, Selena. And anybody who wants to use the chat for questions or just to say hello, if everybody wants to say hello and say where you're from. I am Michelle Stafford, and I'm from North Baltimore County.
You sound like you from Mars.
Mars.
You hear it echo?
You can just in the chat if you want to say hello or say where you're from.
It's Lionel Thomas from Clinton, Maryland.
Hello, welcome.
Thank you.
Oh, shoot, what happened? Okay, there we go.
Got Tom from College Park, and Dream from Brooklyn but lives in Baltimore. Ashley, Baltimore City represent. Sarah in Silver Spring.
Lygia, Parkville, Maryland, Baltimore.
Welcome, Miss Wagia. Angel from Cincinnati, Ohio.
Ohio, Youngstown here,
Hey.
where they got snow 2 days ago.
Really?
Yes.
Wow. Wow. Hey, we got little ones. We love little ones and pets. All right. Okay, good. I've got your email, DB. We have Star from Upper Marlboro. Takitha is trying. Yep, we got people in our waiting room. We have a long waiting list and a lot of people. You guys are really excited to be here. And so we have a nice full house. So just giving people time to come in. Like I said, grab a cup of tea. We're gonna get started in about 2 minutes. Selena from College Park with her emojis. That's right, like emojis. Hannah from Baltimore via VA. Samira from Largo. Welcome, everybody. And you know what's cool about having Zoom is you can name yourself anything you want. Whatever you want us to call you, you can rename yourself. You just click on the little box in the upper right-hand corner, the 3 little dots, and you can rename yourself. All right, so we're gonna get started. All right, so DV, are you ready?
Yeah.
Okay.
Let me just get my video going. All right. How you doing,
We'll
everybody?
find you.
Can you hear me? Check, check.
Yes, we can hear you. Here we go. Hey, Mama. So everybody, welcome. This is our official start. My mom is sticking her hand in the camera. She likes to say hi to everybody. We are here. We are bi-coastal today because we are here in Baltimore on this side, and DB is in LA. I'm just, this is a casual conversation, an intimate conversation. It was really important for us to have an actual Zoom meeting where we could interact. You can leave comments and say, oh, I love that, or tell me more, or whatever you want to say in the chat. Say hello, where you're from. Well, we wanted to make it intimate because we're all about community. And the reason why I chose Colleen and DV for this talk is because they're like two of my best friends. I love these guys, and they genuinely love people, and they care about helping us to live our best lives. They've individually helped me with some stuff that I have going on personally due to post-COVID syndrome and different things. And they've suggested food, meditation, breathing, yoga. So all things I can relate to, things that are accessible. And I mean, breathing, you get it instantly, right? You just, it's right there. It's not something in a far-reaching place. So, DV, tell us a little bit about yourself before you go into your whole chat.
Yeah, definitely. Well, thank you, Michelle, for the opportunity again. I love the community. I miss many of you I met when I lived in Baltimore. I miss it, loved it. I moved to Baltimore in 2010 and lived in Mount Vernon and just totally loved it. Finished my medical training at University of Maryland. And, I moved to Maryland from California. And when I was planning to move from California, Northern California, where I was working at a hospital there, back then the wire was just was popping everywhere. And all my friends like warned me to be careful in Baltimore. And so because they were watching The Wire, they didn't know what Baltimore was like. So I'm heeding their dumb advice. My first apartment in Maryland was in Edgewood, which is on the way to Havre de Grace, 95 North, all the way out there towards Harford County. That was a mistake. Once I realized what the city was like, I worked at Maryland General Hospital, University of Maryland, got to know all kinds of people. I moved downtown, lived in Mount Vernon, Belvedere Hotel, and I just amassed a great group of friends who I'm still in touch with. I miss Baltimore. I miss stuff like Pride. I miss all kinds of stuff there. I'm just my favorite town. I moved out right around Freddie Gray's time. I moved out, and I was coming back to Maryland every 3 months, and then COVID hit, and then I've been in LA manning my office here, and my PA Jamil handles my office in Columbia now. And because of Zoom, I can do video consultations with all of my patients on both coasts. So Maryland is close to my heart. I mean, I talked to 5 Maryland patients today and like 10 yesterday. And so I'm talking to Maryland people all the time. And so I have our medical service I'm an internal medicine doctor, and which means, that kind of means nothing in a way. I mean, from a doctor's perspective, I know what internal medicine is, but when lay people, when people in the community hear what that means, it may not always be clear. Are you an intern or what is that? So internal medicine doctors really are the kind of doctors that can handle hospitalized patients who are critically sick or in intensive care, that kind of thing. Or if they're in the community, they're handling pretty sick people. I mean, the people are pretty sick. There's also family practice doctors. I guess you call them GPs. They see children and pregnant women also. Internal medicine doctors, we generally don't see children and pregnant women. So my main specialty is internal medicine. My second specialty is integrative medicine. Integrative medicine is where we integrate our different modalities like herbalism and also pharmaceutical drugs and acupuncture and hormones and food into a coherent medical system. Also, we integrate our understanding of different organ systems. How does the heart connect to the kidney, connect to the skin, connect to the gut, all these things. Whereas maybe many of you are accustomed to, a doctor, okay, cardiologist does heart, nephrologist does kidney, dermatologist does skin. That's the disintegrated medical system that, is kind of was the progeny of colonialism and reductionism and colonialism, so that's slowly we're reintegrating, we're learning as, as science develops, as humanity develops, and getting away from colonialism. How many more decades it's going to take, but you guys know what I mean. Moving in the direction of understanding reality, and reality is like a human being is an integrated system. And we learn new things all the time. I learn new things about the human body every day because of my immersion in the gut microbiome, which I'll get into in a second. So I'm an internal medicine, integrative medicine doctor, and my exposure to people, and it's because of my 10 years of experience that I'm able to talk about this kind of stuff. And but I learned this, and anyone can learn this, and I love to convey everything I know, the stuff I know, to other people, so that, especially my patients, they can know everything I know, so that they're well equipped and empowered to understand their own body and help themselves become healthy. That's a major goal of mine. Now, within that, my exposure to people is in the hospital. I've been basically a hospital doctor in the mornings in our office practice, which is the Columbia Center for Integrative Medicine, in the afternoons. We do house calls, we do nursing home patients, we take care of them. We do a lot of home health. I've been at the front lines of COVID from the beginning. So I have a handle on that in the hospital, how to help people in the hospital when they have life-threatening COVID, and then how to handle people, the 99% of people that have non-life-threatening COVID who are in the community. But there's a chronic post-COVID syndrome, which I think Michelle alluded to, that is has a lot to do with the body's immune system. Now, before integrative medicine, if an internal medicine doctor was seeing a patient in the community, right? Let's say you look at your insurance card and you see who your doctor is, and you go to an appointment, or you got Kaiser or whatever, you go see your doctor, right? The doctor is going to, I guess every doctor is a little bit different, but they're going to get an idea of your symptoms and maybe give you a medication for that, okay? So that's like the mainstream medical system. You get a medication for, I'm simplifying a little bit, but in terms of the experience that most people have in the community, that's what it basically comes down to. Yeah, there's tons of education and decades of, doctorates and all kinds of studying and stuff, memorizing, lots of information we pile into this skull. But at the end of the day, a person who's having symptoms goes to a doctor who's, doctors are considered priests in the society, right? Or even more. If a doctor says something, then you better listen to it. It's like that, right? So you go and you get a medication, or you get a test, and then the test is looking for something that could be anxiety provoking. So when I entered the professional world of being a doctor, finishing my training, finishing all that stuff, finishing my residency, all that med school stuff, all that stuff, and getting into the professional space, what occurred to me is that the solutions for people in the community should not be the same solutions as for people in the hospital, right? So if you have like a little bit of reflux or heartburn in the hospital, and also you're having a life-threatening bleeding ulcer, right? You need a certain medication that stops that, okay? That's a medication that is life-saving. But what if you're in the community and you got a little bit of reflux, and are you gonna get the same medication from a doctor that you're getting in the hospital? And what I realized when I was entering the space of the professional medical world is that people are using the same thinking, whether you're in the hospital or not. And that's because of the sort of, the limited scope of options that doctors have. I think a lot of doctors have they have a limitation to what they can offer you. All of us, there's a limitation. And plus, but the doctor never wants to convey that they're not confident about their space, right? So they'll confidently pull out that prescription pad and hand you a script, right? What I realize is that you can't have the same thinking. A life-threatening medical problem that leaves you in the hospital should not be dealt with in the same way as a chronic problem that's in the community. Now, what had occurred to me is that there's laws of physiology. How does the body work? And health, I think we often are so anxious about disease, right, in the society, but we don't often ask the question, well, what makes somebody healthy? We think that it's just automatic. Oh, genetics. Ow. What I learned as a result of the last, integrative medicine training, gut microbiome, gut metabolomics, which I'll define in a second, is that there are laws of physiology that allow the human being to be optimized. Okay? Now, if all the physiologic systems are optimized, a person's going to be not having many problems, medically problems. They won't have many symptoms. They won't need to see a doctor. Won't be on medications. They'll have good bowel movements and good skin and look and be athletic and have good muscle fat ratio and not have trouble with weight and stuff. And we look at people like that and we say, oh, there is something really special. Oh, they got good genes. Well, they have their systems in place. The rhythms of their body are harmonious. It's like good music, right? You hear good music, whether it's classical music or hip hop or R&B or whatever. And when there's good music, there's a coming together of all the elements: the rhythm, the low end, the high end, the piano, the flow, the singer, and the cohesion. All of it together makes the music good. It goes into the ear, and we get the pleasure of that experience. If there's something off, right, if the rhythm section's off, but the violin's fine, or if there's something off with some one element of the music, right, even if everything else is great, our ear is going to notice it, and the more fine-tuned our ears are, we're going to notice sort of mistakes in music, right? So similarly, with the body, there are regulatory mechanisms in place, and unfortunately, doctors didn't really learn. I mean, we don't really get that education about what are the regulatory systems in place in the human body that perpetuate health or that create health. We lived in this weird vacuum. I think a lot of doctors still live in this vacuum that, okay, you got a problem, take this medication. And then the business of being a doctor is so complicated, and doctors want to avoid lawsuits and not be working all day, but they're workaholics. And at the end of the day, it's very hard to remind yourself, what is it? The end game here is about a human being becoming healthy. And that process to go from a place of not being healthy, of having a disease or having a symptom of something, right? And turning that experience into one of health and thriving. That process is the end game here. But how do you achieve that goal when you're hearing a symptom and giving a medication? There's so many missing steps there. Okay, the medication may be useful and maybe, appropriate, but what's the end game of that medication? How are you going to transform this person's health so that their physiology so that they're healthy? So these are all the questions that piled in my head when I was a young doctor or med school. Also, I'd seen my father have stuff like breast cancer. An Indian man having breast cancer is kind of a rare thing. I saw my mother, I saw my parents have all kinds of certain medical issues that were puzzling. And so, often when doctors don't know what's happening, they'll say, oh, that's genetic, that's hereditary. Nah. I mean, very, very rarely are we going to see a real hereditary problem. You could say, oh yeah, I've got high cholesterol, my brother has high cholesterol, my dad has high cholesterol, everybody's high cholesterol. That doesn't mean that it's hereditary. Just because the people in your family have something you have does not mean that's hereditary. Well, as soon as you say that something's hereditary, right, you're destining yourself to have that thing forever. You're destining yourself in that narrative. And that's unfortunate. So one of my goals of this talk and anything I do with you guys and with Michelle's community, anybody really, is to we have to become more dynamic about how we think about ourselves and about medical stuff and our health. We need to become more dynamic, right? And I'm saying this because this morning I was in my hospital, handled another COVID patient, handled all kinds of life-threatening issues. A 23-year-old with a platelet count of 3. It's pretty scary. And then I did 3 hours of integrative medicine with some patients over video, going over gut microbiome test results and the nuances of their immune system and why they have the problems they have. And then I played 30 minutes of piano, and then I meditated for about 45 minutes. So that's the range of my day, and so for me, thinking dynamically, and that doesn't mean that one aspect of thinking dynamically is not simplifying what is really a complicated matter. Reality is complicated, but it doesn't mean that it has to be overwhelming. one of the things that I feel like my job is, and I feel like any doctor's job is to take the science and translate it. Translate the science, not because anybody's not educated, but the science can be complicated. And I just, and when you get my document, you'll see some of the words that I put on my document may not know what those words are. Maybe you're like a highly qualified teacher or engineer and you don't have the medical training of knowing what these words that I on my document are. That's okay. Our job, the doctor's job, is to translate. It's okay. Translate that information into practical, useful information for you. It doesn't matter what I know. What matters is how well empowered are you going to be as a consequence of the information you get through your ears into your brain, processed, and then that information gets translated into your actions and your thoughts and your words. That's the stuff you can control, and that's the space that I'm interested in optimizing. Okay, so now I mentioned gut microbiome in this whole topic about, okay, well, how do you get beyond just using medications to help people and or looking up, or even using, you could just use herbs or just use medication or just use one particular thing. But what I've realized is that you have to find out what's right for each person, what's right for you. And maybe you have some ragweed allergy every time in April, you get snotty and so on. And maybe what's right for you may not be what's right for, your sister, who every time they come near your cat, they start getting itchy, right? And they may both be technically allergies. And if you go to an allergist, technically you're going to get the same medication for both problems, right? But now if you're in the integrative medicine space, you're going to do more. You're going to get more complicated. You're going to ultimately find the right solution for the right person, because that leads to success. If I find the right solution for the particular problem that I'm working on, then the likelihood is, because it's the right solution for the right problem, that person's going to do well, recover, and then say that, hey, I did well. I've entered a space of healthiness, and I don't need you. And I love that when my patient can say, I don't need you anymore. They can move on, and that's excellent. And my financial backers, they say that's bad for business, and I say, yeah, but it's good for humanity. That's a really great thing. So how do you do that? How do you know what is right for what particular person? Is it my belief system? Oh, I'm Indian, so I must be into meditation and yoga. Well, that's true. But the reality is that in the last 15 years, one of the great things about being an integrative medicine doctor in this day and age, is the science of the gut microbiome, which is this constellation of microbes, bacteria, funguses, viruses in the human body that is intimately connected to your immune system. Okay, so this is called the gut microbiome. It's called the human microbiome. There's microbiomes everywhere, on the skin, in the brain, in the hair, on the scalp, in the nose, in the mouth, in the ears, in the throat, in the lungs. There's no sterile area in the body. Okay, there's no sterile area. You got to realize that until 2005, every doctor out there thought that the body's sterile. And so if there's bacteria, kill them, right? Talk about colonialism. This is crazy. We now know, as a result of the last 20 years, that these microbes settled the human body 200,000 years ago. 200,000 years ago. And they're essential to our immune system knowing what to do. Okay? The immune system has to get feedback. It's kind of like if you're talking to somebody and you can't hear them, and you're talking to them and you're waiting for a response, but they can't hear you, right? Like when people on Zoom are on mute, they don't know they're on mute, right? That kind of thing. And you're waiting for feedback, you're not going to know what to say. If they're not saying, they can't hear you, you don't know if they can hear you. You may yell because you want them to hear you, or you're going to get angry. You don't know how to respond. Analogously, the immune system needs feedback from the world. But even though you can look outside your body and see what's going around in this nice little imaginary world we call external reality, we'll save that for another talk, why I said that. You can get feedback from the world using your senses, but the immune system needs to get feedback from the world. But it doesn't have eyes and ears to look at what's outside. So how does it do that? It responds to microbes. The microbes in all these different areas. all these different microbiomes, the ear microbiome, the gut microbiome, the bladder microbiome, the skin microbiome. All these areas have microbiomes, little areas of, areas of where microbes live in close proximity to human tissue, and there's no war between them. It's not like they're not supposed to be there, all right? These bacteria are supposed to be there. They've been there for 200,000 years. Now, the immune system has learned what to make a big deal about, what not to make a big deal about. Let's say, for example, let's say you're having a bad day and you're getting all kinds of stuff from different places coming at you. You're going to have to think in triage, right? You're going to have to say, I'm going to make a big deal about that. I'm going to not make a big deal about that. I'm going to make a big deal about that tomorrow. But, right, I'm going to focus. Otherwise, you're going to just come apart, right? If everything's coming at you and you're not like sort of prioritizing what to fuss about, you're just going to come apart. From an immunologic perspective, coming apart is a dysfunctional immune system, okay? And that's what we call disease. Mic drop. Now, that's what disease is an immune system that's not able to function, doesn't know what to do. So the immune system loses tolerance, you know, which the word tolerance in a sociological setting is kind of funny. It's like, oh, I tolerate you. And it's like, but in an immunological sense, we kind of want that. We want the staph and the strep on our skin. We want those bacteria to have a harmony with the human cells, right? The human tissue, the skin cells. We don't want them at war with each other. We want them to tolerate each other. We don't necessarily want them to love each other, but we don't want them to be at war with each other. But from an immunologic perspective, the word is tolerance, immunotolerance, or immunoquiescence. Quiescence, quiet, as if there's no immunologic fussing. That's harmony. So then, we now know, as a result of gut microbiome science, metabolomics, enteroimmunology, there's scientific journals, everything I'm saying I can substantiate with clinical data, scientific science that's publicly available. I don't have to make it up. I don't have to come up with it. It's all online. It's all publicly available. We know that health is a state of physiology where there is a harmony between the microbes and the human DNA. The microbes and the human DNA are interacting in real time throughout the day. And it explains things like maybe at 12 o'clock today, 12 noon today, you felt like a little, you felt a little hot. And maybe you took off, you did something, you took off a sweater. And then maybe 30 minutes later, you felt like a certain part of your body was itching, right? Like the kind of stuff we would associate with random body stuff. There's nothing random in life, right? Random was probably some colonialist that came up with this, couldn't really admit that they didn't understand how the world works, so they came up with the word random. You know, from a mathematical perspective, there's, in computer science, the word is stochastic, which is the scientific word for random, which just means that you don't know how it works and you don't have, and you're too arrogant to admit that, right? Now we know that there are these cause and effect, there's laws of physiology, there's so many magical things happening at every given moment that makes this miracle that you are, because we're, you know, me and you, we're the same. We're human, we're these human superorganisms that are descendants of 200,000 years of human experience, you know? It's amazing. So from a physiologic perspective, our moment-to-moment body rhythms are regulated by microbes. Now, I keep saying the word rhythm because actually it is rhythm, because certain things like, oh, you know, some people say, oh, I'm like clockwork. You guys say it yourselves. Oh, when do I have a bowel movement? Oh, I'm like clockwork. You say that, right? Or some people with chronic fatigue out there, they're like every day at 4 o'clock, they just crash and they need coffee or ginseng or something. You know, we all have this idea of that there's certain rhythms. Or maybe if I'm a woman and I'm having really painful periods, and then I know my period's coming because like I'm getting like mood swings and stuff. So maybe 5 days before a period, these things happen, and you know that happens to you every month, right? So there are these rhythms to our body. Now, rhythms, just like in music, rhythms can be functional or dysfunctional. Part of being healthy is having healthy body rhythms. Right? How do you control your rhythms, including your sleep-wake cycle, you know, the libido cycle when a person's like having sexual activity, the eating cycle, rhythms of when I'm hungry, when do I eat, when do I stop eating, you know, all of the different decisions we make for all these vegetative functions in our body, you know, all of these things need to be harmonious. Now, that is our opportunity for intervention, because when we analyze somebody's rhythms, like in our medical setting, we can get an idea where are the dysfunctional rhythms and what could be causing those dysfunctional rhythms. Then we intervene there. Okay, so I wanted to just bring these ideas up because that is really my introduction to why, you know, why my approach to allergy is what I'm about to talk about. Now, so just to summarize so far, our immune system makes us healthy. Our immune system is controlled by microbes. Where is most of the immune system? Is located in the gut. So I've got this reputation as being this gut doctor, but I'm not a gastroenterologist that looks for tumors and stuff using endoscopy. They'll like go up from below and go from above looking for tumors and stuff like that. Gastroenterologists don't care about the microbes in your gut. They don't care about your immune system. They have to do what they do. What I'm talking about is the microscopic aspect of your gut. Now, I talk about the gut because the biggest microbiome in the human body is in the gut. So 80%, 85% of the microbes in your body are in your gut. And because they're mostly in the gut, that's where the immune system is. Because I said before, the immune system learns from microbes, right? That means that your immune system has started learning. And remember, learning leads to knowledge. Knowledge leads to the right action. Dharma. In Sanskrit, we call that dharma, the correct thing to do at any given time, based on, and you can only act based on what you know, and you can only know after having learned. Education is like literally the truth. From an immunologic perspective, you're learning from the moment you are, I'd say somewhere in the 9 months that you're in utero. Why? Because mom's microbiome, the placental microbiome and the uterus microbiome affects your health. So your mom's health and her habits and her antibiotic exposure and her drug, what the medications she uses and her mood, how well supported, you know, a woman that is well supported, that's pregnant, that is emotionally balanced and healthy and happy and connected, is going to have a different immune system and a different baby experience than somebody who's alone, or you know, the single mom is sort of like this amazing. How that happens is absolutely flabbergasting to me. I find it, I'm so full of reverence and awe towards the woman, and to be the single mom is kind of a revolutionary thing. We need to be. I want to be in a world where women are, especially in the act of giving and making life, is that they're as supported as possible. Because I mean, the immune system is starting to change and learn. Now, just like there's schools that are good and schools that are not so good, you know, I'm not making a comment on public versus private. And it's private. I went public school my whole life, still behind that. But there are good teachers and there's not so good teachers, and there's a good classroom experience and there's in the learning process. The same thing happens immunologically. Okay. There is an opportunity for a baby's immune system from in utero all the way to becoming a 44-year-old man. That whole process, there is an opportunity for the immune system to be really competent, really knowledgeable, really applying that knowledge into the right action, total hero. But then there's opportunities, unfortunately, for the immune system to not get such a good education, right? Now, if the immune system doesn't get a great education, then the body's going to be different. Right? Now, one big example of this, big example of this is that if you look at genetically similar people, like say in the west coast of Africa and the east coast of this country, right? Because of this awful travesty of slavery and all this stuff, we have the genetically similar people on opposite sides of the Atlantic Ocean, right? So if it was genetics alone, their health should be similar. But it's not like that at all. We see like so many people in West Africa that can tolerate milk, especially fresh milk from that's not been processed, you know, whereas most, I mean, you're not going to find that many African Americans that really tolerate dairy that well or that drink a lot of milk, right? What about the amount of lupus and obesity on the East Coast compared to the amount of lupus and obesity on the West Coast of Africa? It's like massive amounts of differences between these two. What about the amount of autism and ADHD among Somalians that live in Minnesota compared to the amount of ADHD and autism among Somalians in Somalia? Night and day difference, right? So we got to get heredity. We got to get the genes out of your head. You know, the genes don't matter. It's the epigenetics, means what affects your genes, what tells your genes what to do, right? Get to the underlying cause of why the immune system is not working that well. And it's not to do with heredity, okay? Now, nor is it the environment. Now, I know we're talking about allergy, and we're used to blaming the environment. Oh yeah, it's the ragweed. Oh yeah, it's this kiwi that my food allergy test said I'm allergic to kiwi. Yeah, it's the kiwi. Yeah, that's it. No. We got to talk about ourselves. Always look within, look within. Don't look without, look within. And that's going to be looking at your immune system. If your immune system didn't learn so well along the way, or certain aspects got in the way of its learning, you can't be surprised. If a child is learning great, right, in school, from first grade, second grade, third grade, fourth grade, and then in fifth grade, the child goes through some traumatic experience, right, then their learning is going to be off. And you can't be surprised that their learning trajectory by the time they get to eighth grade is different. It's not what it could have been if that trauma didn't occur, right? But we live in a world where there's trauma everywhere. It's ridiculous. It's just ridiculous to think. It's horrifying when I ask about trauma to my patients. I ask them about emotional trauma, sexual trauma, physical trauma, and I mean, in the world of chronic disease, I'm not talking to every human being on this planet, but I talk to a lot of people with chronic illness, and I'd say, 80 to 95% of them have some sort of trauma that if they talk about it right now and it happened 25 years ago, they'll still cry as if it happened right now. That level of PTSD type of trauma, it's heartbreaking, absolutely heartbreaking. That's why we got to get into emotional tone and processing the mind, processing the thoughts and emotions. And there's a whole level of healing that has to occur that's way beyond the physical. Physical is scratching the surface of reality. So we want to make the immune system well educated because it will do its own thing without any doctors, without anything, if it's well educated. How do you educate the immune system? We're doing it all the time. Existing, being alive, is educating. And the food you eat is the major educator of the bacteria in your gut. And the life experience you have, the how much connection you have to others, how much you touch, how much exposure to sterile environments. Many of you have heard of the hygiene hypothesis. So, upper class Western kid gets sick all the time because they're in sterile environments. And then, the dirty Indians are playing in dirt and they don't get sick as much. So that's like scratching the surface type of media friendly type of thing. And there's evidence behind that. But there's also evidence to show that just simply being in a Western environment, just being Westernized, being in an urban environment, right? Not outside of where we all come from, the villages in Africa, India, Asia, China, Europe, and in the rural areas, being outside of the environments that we all, our family lineages grew up in over 200,000 years, will induce a dysfunctional immune system. So that's why just alone, being a product, this is colonialism. Colonialism created all this. Explains why I'm talking in English and not in Sanskrit. And this is all the consequences of that. There's an interconnection between all the events of this earth with each of our bodies, and an immunologic level. The butterfly effect, immunological action, right? So how do we make the immune system healthy, and how do we develop dysfunction and manifest with allergies? So allergy, first of all, I think maybe if we polled everybody here about what they think, what they think allergies are, I think we'd all come up with different explanations. And I think that if you ask doctors what they think allergies are, you may get different explanations too. People know about everybody knows about the symptoms and all that. We don't have to define that. But what I'm interested in is talking about the causes and what we can do about it. We do know that allergy is related to something called IgE. It's the antibody that causes histamine to be dumped in. Ultimately, IgE will meet some chemical like ragweed or pollen or something, and then that IgE on the other end of it will trigger a cell to dump histamine into the airway. And then if you get diagnosed, or if you take Benadryl or Claritin or something, then maybe you think you have allergies. Maybe it happens when ragweed season comes, or environmental, or maybe you moved from one place to another and you developed an allergy or something like that. Maybe you went to a doctor and they told you have allergies, and so on. But I think one thing that is common experience, despite your definition of it, is how that antihistamines help you. Okay, Benadryl, Claritin, all these kind of drugs, if they help you, then some of these we can suggest that may be allergy. Okay, or but it's now also there's a whole bunch of doctors called allergists that specialize in this. Okay, and but they focus on the first line of the immunology, just the IgE. Now, if you go to allergists, they're going to do things like skin pricking to test if you have an immune response to certain chemicals. They'll desensitize you to those things. They'll give you drugs that suppress the immune system that can help with allergies. Okay, they don't care about the microbes. So if you go and bring my information to an allergist, they won't care. This is not in their textbooks of stuff that they learned. All right. We know, and honestly, if they're under 50, they won't know what the microbiome is, because like I said, it was just discovered in the last 15 years, 20 years. Okay, so we know that IgE is the main antibody, but there's other antibodies in the human body. Okay, now each IgE is specific for a specific allergen. So there's an IgE for your cat, there's an IgE for the dog dander, an IgE for all these other things. Now, when I heard all this, when I was, say, on the receiving end of a lecture from some know-it-all doctor, I would say, okay, well, what makes the IgE go on? Like, who tells the IgE to do that? Does it happen randomly on its own? And most of the time you're going to say, oh, yeah, you got exposed to pollen, you got exposed. And that makes it seem like just being alive puts you at risk for disease. But I told you that's not what happens, right? Being alive is not the risk factor for disease. It's the immune system that's not performing well that's leading to the disease. And this question about immune system in the gut, yes, the immune system is in the gut. So when I talk about the gut, I'm talking about immunology. Okay, it's enteroimmunology. Entero is gut, immunology is the immune system. So to manipulate and this is where food comes in, and probiotics and prebiotics and all that stuff, and candida and all of that. Okay. So IgE tells the cells to dump histamine in there, right? Right. Next, what tells the IgE to be made? Because can you imagine if you got an immune system that makes tons of IgE, you're going to be one of those people that are allergic to everything. And if you make IgE just a cat, then you're going to be allergic to just a cat, right? And is every hypersensitivity allergy though? If you get like a rash after eating some bread, does that mean it's allergy? Not really. So in the hospital, allergy is thought of as a big deal because it can be life-threatening. There's anaphylaxis and it can close the airway and you're done. So there are some things that can do that, cause anaphylaxis, like peanuts. I mean, anything really, but the common ones are the GMO foods like peanuts, and some medications can do that, and bee stings in some unfortunate people. But it doesn't mean that bee stings will do that in everybody. We know people that have been stung by bees millions of times and not one immune response that's negative. In fact, bee stings is a very common alternative medicine for chronic Lyme disease, actually. So there is so it tells you your immune system is doing that, right? Or is creating that dysfunction, right? Now, there are two types of immune responses, and it kind of makes sense. If I told you that the immune system's job is to develop a relationship with microbes, right? What are the microbes that the immune system is making a relationship to? Well, there's bacteria, and there's fungus, and there's worms, okay? These three, and there's viruses, okay? These are the four big ones. Now, worms and funguses are outside of the cells. They don't infect the cell. They are outside of the human cells, and then they create dysfunction outside of cells. So logically, we know, right? We can think if the immune system's job is to protect us from microbes and develop relationships with microbes, then there must be just one immune system just for extracellular pathogens, which means stuff outside of cells. Those are worms and funguses. That is called the Th2 immune response, and it makes antibodies. What's IgE? Is an antibody. So the origin of allergy is the immune response that is meant for worms and funguses. Okay. Now, there are places around the world you're not going to see any allergies. Places like tropical climates, right, where there's lots of worms. You're not going to see allergies. Go to Indonesia. Go to where my family originates from in India. You know, you can go to Mexico or go out into the rural areas of Mexico, and you're not going to see. Now with industrialized agriculture and farming, you're seeing like farmers develop allergies. Farmers have been working in farms for, when did farming was invented? 12,000 years ago that we know of, way earlier than that, but clear evidence, Göbekli Tepe in Turkey, right? 9,000 BC. So 10,000 years, farmers, right? And now we're seeing an epidemic of farmers getting allergies. Okay? We got to stop blaming the environment. We got to stop realizing it's the immune system here. So the part of the immune system, Th2, that's responsible for handling extracellular bugs like funguses and parasites, they make antibodies, because antibodies will coat the parasites and the worms and the funguses, and it'll coat them and kill them from outside. Compare that to viruses, which work by going inside of the cell to kill it. So you need a different kind of immune system to kill infected cells. That's for viruses and some bacteria like chlamydia or Lyme disease or syphilis. These go inside of the cells. And so you can't use antibodies, right? If there's a virus inside of a cell, you can't use antibodies because the antibodies will just coat the cell. It won't do anything. You got to kill that cell. So that's the Th1 immune response. Okay? Th1 cytotoxic T cells, they kill infected cells. Right? Th1 kills infected cells, Th2 makes antibodies. Now you understand the immune system. The two aspects of the immune system. And dysfunction here will lead to problems. In some people, it will be autoimmune disease like lupus. That could be allergies in other people. It could be just getting sinus, getting stuffy all the time. It could be diseases that are responsive to antihistamines, which are, I guess we can call allergies for the sake of the lack of a better word. All right. Now, Th1, Th2. What if your Th1 is suppressed? Now you're going to be making antibodies against everything. Okay. There is a mechanism where if you change your gut bacteria after antibiotics, your Th1 will get suppressed, and now there's just Th2. So Th2 people, right? These people who are excessive to Th2, they're going to be making more what? Antibodies, including IgE. So they're going to be hypersensitive to the environment, and they're going to be making more IgE. That'll cause more histamine to be dumped into the airway. Okay. And so one of the problems of interfering with a child's development or an immune system's development is that you can lose regulation of the Th1 and Th2. You want both of them because they're the two aspects of the immune system, so that you don't want them to both be working. But if because of immunologic mechanisms and people don't know because of this world we're in, you know, there's so much toxins and stuff. I don't expect anybody to know. This is the point of learning this so that we can change things, right? But if as a result of your life, you know, maybe you got some antibiotics and processed food, maybe your mom couldn't breastfeed, you know, it happens, you know, then maybe your Th1 is suppressed. And now you have overactive Th2. You're making tons of antibodies, including IgE. You're going to dump tons of histamine into the airway. You'll be hypersensitive. You know, you could be growing up in Michigan like I did and move to California and develop an allergy to something in the environment in California, right? Or you could be born in California, grow up in California and move to Michigan and develop the same allergy when you move to Michigan that the person who moved away from Michigan developed in California, right? And then but we're so caught up in our own personal experience that we just say, oh yeah, when I moved here, it was, but then whenever that happens, not every time somebody moves, they develop an illness. Then I ask, okay, well, what happened during your move? What was it like? When you're a child and you move, it could be traumatic. It could be a big deal. You got to leave school. You got to, so the trauma to the experience could be affecting your immune system. Okay, trauma and stress and all the relationship you have with your mom and your dad and to the degree you've been hurt by others, all of that affects your immune system. So there's mechanisms by which non-physical things, like behavioral things, like your life experiences, how that affects your immune system. Okay, there's tons of that out there, and so that is in addition to the chemicals that can change your gut bacteria. Right? So that's like the immunology of this, and then we say, okay, well, how do we educate the immune system well, and then how do we make sure the Th1's not suppressed, so that the Th2 is not overactive, making too many antibodies? Well, you want the Th1 to be optimized. Now, a lot of the herbs that my colleague is going to talk about in the next talk actually works on increasing Th1. And I mentioned one on my document, like there's an herb called astragalus that does exactly that. Okay, so now we understand the immune system, and we say, okay, there's two aspects of the immune system. The immune system learns from bacteria. So, like, then is there proof though that if you change the bacteria, you develop the allergy, right? Let's take away the middleman. Let's let go of the IgE and all that stuff. Now let's think about the microbes. If the immune system responds to the microbes and changes and develops allergies, right? And like I said, allergies are, you're going to see more allergies in Western privileged societies, more, okay? And even if you're poor in a Western world, right, you're still going to be exposed to it, unfortunately. And I compare that to the rural settings we all come from, okay? I'm talking about like rural Africa, rural India, rural China, rural Europe, okay? Which Europe hasn't been rural in a while because they colonized themselves before they colonized everything else. But the point is that more exposure to just natural stuff like plants and animals and so on, not much allergies, okay? Susruta, Indian surgeon, has this complicated medical textbook from 3000 BC. Read it, nothing about allergies. Leonardo da Vinci is all of his books on medical stuff. Nothing about allergies. Galen, nothing about allergies. So we can say that allergies are not exactly the oldest, it's autism. You're not gonna see autism before 1950. You're not gonna see schizophrenia before Plato. Some diseases, they start at a certain time. You're not gonna see lymphoma before 1935. You're not gonna see heart attacks before 1850, right? Some diseases start. And we live in a time where allergies are ubiquitous. Means that everybody's got them. Everybody's got an allergy of some kind. Why? Because we've got widespread microbiome dysfunction in our modern world. That is why we have a chronic disease epidemic. Okay? So let's eliminate the middleman for a second, the IgE. Now we got the microbes and the disease. Now, eczema. Here's an allergic atopic dermatitis. It's an allergy disease of the skin. There is evidence to show that if you change the microbes, you'll develop eczema. Anyone can develop eczema if they change their microbes to basically create that immunologic dysfunction that leads to the itching and so on. What are those microbe changes? Well, you alter the Th1, Th2 balance, okay? You get too much staph and decreased strep, okay? Most of the bacteria on the skin is strep. If you decrease it to make more staph, and you decrease Acinetobacter and Propionibacterium, then you're going to get eczema. Now, Propionibacterium is the same bacteria that causes acne, right? So you're not going to see eczema and acne in the same skin. It's going to be one or the other. Both are related to the microbes that for 200,000 years had nice balance with your skin. And remember, they're everywhere. You can't eliminate or sterilize the body. You will induce disease. If you sterilize the microbes out the body, you will get sick, you will not live long, and probably get cancer. And we know cancer is a microbiome problem. You can't develop cancer unless you mess with your microbiome. It's physically impossible. Okay. Now, so many of these diseases that you go to a dermatologist for, eczema or acne, they're not going to think about the microbes. Unfortunately, if they do, they're going to give you antibiotics. That will lead to more problems because, as I said, antibiotics will sterilize the gut. It'll sterilize the sinus nasal bacteria, and then you're going to have immunologic dysfunction because you change the microbes. Everybody probably at this point in 2021, April 22nd, everybody probably knows that antibiotics kill bacteria and it's bad for you, right? But it's way more complicated than that, okay? Way more. It's not enough to just take antibiotics like candy and then take some and eat processed food or non-organic food, which is full of antibiotics, bread full of antibiotics, meat full of antibiotics, right? You don't have to, you don't necessarily have to be a hippie, tree-hugging vegan, Whole Foods person or mom's person to just want to avoid antibiotics, unless you want antibiotics. Like when I treated life-threatening sepsis this morning, I had to use antibiotics because it works. Done. It's not like I'm anti-antibiotics, but you got to know what they do. And now we have 50 years of research into what they do. They basically create a whole new generation of diseases. Okay. Now, and I want to distinguish IV antibiotics versus the kind you take orally. Now, if you go to a dentist, you're going to get antibiotics. If you go to a ENT, a GP, any doctor, anybody with MD after their name, you're going to get antibiotics. And you probably got, if you're one of my patients on here, you probably gotten them from me. It's kind of inevitable, but it's incumbent upon you to know what their impact is. It's not just getting rid of bacteria that you can take probiotics and improve that. If you change the balance of the bacteria, that's going to induce disease. Why? Because 200,000 years of immunological relationships. Okay, my skin is really happy with this 80% strep, 20% staph, and I'm at peace with that. And my skin, look, it's clear, no rash, it's glowing, it's healthy, it's soft, right? And like all of our ancestors probably said, and many of us may say, you change the balance of the bacteria off, you're going to change it. You're going to change the immunologic understanding of it. It's kind of like if you you do first grade, second grade, third grade, fourth grade well, you're in fifth grade, and suddenly you just take all the desks are gone, but you're in the room. There's no desks, and the teacher doesn't want to talk. So you're still in school, but you're not really getting the education you were getting. It's going to change things. It's going to just change the education. Okay. Here's another one: Candida, fungal dysbiosis. I said before, it's extracellular pathogen, so you make Th2, right, to make antibodies to fight it. If you get too much Candida in your body, it's going to trigger allergies, okay, and asthma. There is a mechanism in which if you have fungal overgrowth, and that will occur after antibiotics, or if you eat lots of sugar or processed food, that will still occur, then that will stimulate a Th2 response, increase IL-4 production, and stimulate airway inflammation. Okay? And it's well known, even among pulmonary doctors and which are lung doctors, that sometimes you give an asthma patient antifungal drugs and they'll get better, right? So, and I routinely, every time I see asthma or allergies, I test them for Candida, and that'll usually work. So, now bacteria, we get penicillin from mold, which is a fungus. So in nature, fungus and molds are at war. They don't get along really, or they work to balance each other out. Okay, I don't think there's anything war in nature. I think that's all just because we've been traumatized by colonialism. That we see war in everything, right? Or these National Geographic videos that just focus on the predator killing the prey. But what about 90% of the time when the predator is just chilling, right? Then, life isn't as evil as the system wants us to think, right? But anyway, bacteria and mold and funguses, they have chemicals that offset each other. The penicillin we got from Alexander Fleming discovered penicillin, that comes from a mold. That mold used it to kill bacteria, right? So think of that logically now. There's tons of bacteria, 40 trillion bacteria in the human gut, and and in women, excuse my language, the vaginal mucosa, the bacteria of that private area in a woman will educate the bacteria of the bladder. So if you have healthy microbes in your private area, you're not going to get a UTI. Okay, and sometimes if you change the microbe flora of the private area, you could get a yeast infection. Women that get that, or in men will get prostatitis, or can get, I guess men. A lot of people focus on this stuff only when they get an STD, but this stuff can happen in real time too. And unfortunately, a lot of people get UTIs all the time, and often they get a UTI and an antibiotic, and then it comes back, a month later, or 2 months later. So you've changed the microbes of your bladder. Now, if you lose bacteria, then funguses will thrive, because even between my face and this screen, there's tons of mold spores. There's funguses everywhere. The world is so full of all this microscopic action. It's kind of amazing, and so these microbes are everywhere. So if you decrease bacteria, the funguses will grow. That's why people get yeast infections after antibiotics. But that can also occur immunologically. Sometimes some women before their period will get a yeast infection, and they even know, oh, I'm getting yeast. I feel yeast symptoms, and I know my period's coming. Well, why? Immunologic changes because of the hormone imbalances, and that can lead to fungal overgrowth, right? So we don't want too much fungus in the body, and that's where people think about Candida. And I don't think many mainstream doctors are still on the Candida tip yet. I mean, there are infectious disease doctors that understand that Candida can infect the body, but most of them think that you have to have HIV or something to get a fungal infection, or just have had antibiotics. But Candida is a big problem. Most people with chronic sinusitis have Candida living in their sinuses. So you get, let's say how many people here have chronic or recurrent sinus infections? Okay, I've practiced in Maryland long enough to know that so many of you do. So how does that work? Well, you get an infection, maybe a painful face, and then the headaches and all this green snot. You get an antibiotic, you feel better, because that acute infection is caused by bacteria. But then once you kill it now, and you go back to your normal, what's happening there is there's fungal overgrowth. Chronic recurrent sinus problems are caused by fungal overgrowth of the sinuses. Why? Because the sinuses are full of air, and bacteria are not gonna, they need mucosa. So microbes that thrive in air are gonna do well in the sinuses, and that's mold and funguses. So after you've taken the antibiotics to kill your infection, your sinus infection, you're back to having fungal overgrowth in your sinuses, and you're gonna have a postnasal drip, and sometimes that'll trigger allergy, and then you'll take Benadryl and you'll feel better. You'll take Claritin and you feel better. And you think, oh, I've got allergies. And then it doesn't go away. Test them for funguses, get rid of the funguses, allergies go away. What else? I said before, a woman before her period can develop a yeast infection. What about vitamin D? Vitamin D, people talk about, oh, it's the sun and sunscreen. You know what? I don't want to talk about the sun, because people use too much sunscreen because lighter skin people are so scared of skin cancer. Yes, but the amount of vitamin D you have in your body is the amount there's no real understanding of what is the right level, okay, of vitamin D. Institute of Medicine says 33. For my patients, I shoot for over 50, because I have seen that vitamin D will go down because of inflammation. Inflammation drives hormones down. Inflammation, which is the immune system trying and fussing, but not being successful at it. Inflammation will lead to cortisol going up, and then estrogens can go up in some people, but progesterone goes down, thyroid hormone goes down, testosterone goes down. This is why we're seeing so many people with hormone imbalances. Like every woman not every, but 80% of women over 50 in this country have a thyroid problem. Well, there's a reason for it. Go to the underlying cause. Vitamin D is a hormone. It will go down in states of chronic inflammation, and that can lead to allergy inflammation, and then that can be treated with vitamin D. Asthma, same thing. Asthma is an intestinal disease. It really starts in the gut, and there's an intimate connection between the gut microbiome and the lung microbiome. Because the biggest microbiome is in the gut, all the other microbiomes take signals from it. Signals, what signals? Vitamin D, I'll come back to vitamin D in a second, okay? But there is the signals are called inflammatory cytokines. There are things like IL-4, TNF-alpha, these are chemical signals. They're like if I'm talking to you and I say words, the words go into your ear, into your brain to process, right? So analogously, the immune system communicates with inflammatory cytokines, and they're ways of communicating at distal areas. So you think that your gut and your lungs are separated, and they are physically, but they're communicating by these chemical signals. Okay, and so if you change the microbes of the gut, then you can change the immunology of the lung, and you change the microbes of the lung, and that can develop, that can manifest as asthma. But asthma, most people go to a pulmonary doctor or a lung doctor who also thinks that it's you're out of luck, so you need the drugs for asthma, and you shouldn't smoke, and that's basically it. But there's so much data about probiotics and plant fiber foods and avoiding antibiotics that actually can improve asthma. So if you're breastfed as a baby and then you avoid antibiotics and you eat plant fiber as an infant, you're less likely to get asthma. If you are premature birth or a C-section, or you're in the neonatal ICU and you're getting antibiotics and you can't get breastfed and no one's touching you, and you're not getting any microbes, you're not going to get the microbes to educate your immune system, which is in your gut. And so you're going to higher risk for allergies, eczema, autoimmune disease, and asthma. So what's the link with farmers? Well, pesticides. It's the pesticides. It's industrialized agriculture that's increasing the risk for asthma in farmers, right? So again, we cannot blame the chemical. We can't blame the environment, like the pollen and stuff. We got to think about the new chemicals that are in the environment, like the Roundup, the Glyphosate, all of those, and those endocrine disruptors that are in the environment now. Vitamin D is a steroid hormone, just like testosterone, just like estrogen, just like progesterone. It's a steroid hormone. It's made from cholesterol. What's a steroid hormone? Is it the stuff that bodybuilders use to get really athletic? No. It's steroid hormones just mean a hormone that's made from cholesterol as opposed to amino acids. So there's two types of hormones: those made from cholesterol, steroids, and those made from amino acids like thyroid hormone. Those are peptide hormones. Glyphosate, Roundup, really big one. Okay, glyphosate is an antibiotic. It's Roundup. It was marketed as an antibiotic in the 70s, came back in the 90s. Now it's in all GMO foods, and it entered the wheat supply in 1992, thanks to Monsanto, which is now called Bayer. Okay, celiac disease started around that time. Okay, people have been consuming bread for a very long time. Okay, no celiac disease. Once you introduce Roundup into the bread supply, the wheat supply, now all the wheat in the world is GMO now. And so if you consume bread, you're consuming glyphosate. If you're taking in glyphosate, you could get celiac, or you'll get gluten sensitivity. Remember in the 80s, those of you old enough to remember the 80s, there's no gluten sensitivity, no celiac disease. Okay, so that's a really big one. So I do a lot too. If I test for this, and you can get rid of this out of your body. Okay, and also it's in vaccines. You get the flu shot, you're getting glyphosate injected into you, right? Antibiotics are the big one though. I've seen that. I'd say about close to 95% of the 2,000 patients currently working with me, 95%, their bodies have been negatively affected by antibiotics. Usually they got it as a kid, and that changed their immune system. Now they know why they have painful periods, or now they know why they have lupus or whatever issue they have. Change the microbes, and a low-fiber American diet, you're going to have chronic disease. Okay, so we really need to intervene early. We got to get the immune system educated early. Many of us are parents. We want to nourish the pregnant moms, nourish just women. And this education needs to be going in there. We need to get the processed food out of our systems. We got to make real plant-based organic food affordable. And we start there, okay? The ideal treatment for neonates is breastfeeding. The ideal treatment for any infants and beyond is plant organic fiber. Okay, there's no benefit to meat to your life, okay, from a medical perspective. You eat meat, that's on you. You can if you want, no big deal. But there's no human benefit to your health. Probiotics, prebiotics, polyphenols, there's other tools that we can use to manipulate your body rhythm so you can have a healthy human experience. Hormones also very important because they can decrease because of inflammation. So balance your hormones, clean up your lifestyle, get the toxins out, optimize your sense of your thoughts and your emotions, the toxic relationships, we've got to work on that. All of this stuff is part of the way to healing. And that's what I got for you guys. So a lot of the stuff I said, if there's confusion about it, I do have a document that Michelle will get to you that summarizes a lot of this with references and the science.
Thank you, DB. It was so hard to cut you, man, like to stop you because you were rolling. And we learned so much, and what you are saying is so accessible and so relatable, and things that we can use. I see people taking notes and nodding their heads and things like that. And this is recorded, y'all. So really focus in and take notes later. Watch it a second time because it's going to be some stuff that that you're going to want to look up later. We're going to add Colleen here. So Colleen is I have to look for her.
Everybody ran outside.
So Colleen is outside, and so we want to she's going to do a nature walk, and so we had to make sure that she was still in the daylight. So here's Colleen, and so some of the stuff that DB was talking about with the natural herbs and I forget the acronyms, what would increase the TH1? The herbs increase TH1? Yeah.
Yeah. I dropped one astragalus,
I've
but
got
there's a lot.
I'm going to show them the house.
Yeah, so perfect. So we're gonna give Colleen the stage, and first tell us a little bit about yourself, Colleen.
Hello, everyone. Thanks, Michelle. Thanks, Stevie. That was so exciting to listen to you speak like that and to hear a doctor who practices holistically and really thoughtfully. So thank you so much for sharing your work and doing your work in the world. It's so important for people to have a place to go to where they can get both natural medicine and they can get Western medicine if they need it. So I'm really, really happy to know that you're out there doing your work on both coasts. And your talk was so in line with what I think herbalism is. And as an herbalist, I took my first herbal training about 25 years ago. About 25 years ago after the birth of my first child. And I developed several autoimmune diseases, lupus and Hashimoto's thyroiditis, Graves' disease, and fibromyalgia. I was diagnosed with and decided to treat them naturally. So I studied herbalism and then put that to the side and raised my children who also had chronic immune issues. My oldest son has celiac disease and my youngest son has issues also. So I turned to the plants. Started studying again about 10 years ago and have been practicing as a clinical herbalist for the last 6 years. I studied with the Mid-Atlantic School of Herbalism, where I now work and actually now part owner in the school. I'm a teacher in the herbal program and also one of the clinic supervisors in our student clinic for the advanced herbal training. And I have a private practice. I practice via telehealth right now because of COVID and do some home visits for people who can't get out. I'd love to do more of that because I think plant medicine is the people's medicine. Plants were here on this planet before us and we've co-evolved together in relationship. And as we become more and more of an industrialized society, we get further and further away from nature. And I think that also contributes to disease because we aren't in our natural rhythm, as Vivi was talking about. We don't our sleep and wake cycle, our eat and rest cycle, our digestion and assimilation cycle is all jacked up because of modern lifestyle. So how can we slow down and how can we integrate and how can we shift the relationship that we have with living in this modern time, which isn't, it's easy to say, but it's not so easy to do. I think plant medicine is about relationships also, and plants can work in so many levels. They can work on the psychosocial level in the body and in the being. They can work on the emotional, they can work on the physical. And so they're just powerful medicine that work through a lot of different aspects on the body. And we can use them in multiple different ways, as tea, as vegetables, and lots of different ways to bring them into our body and into our life to help us do the work we're meant to do in the world. I believe that, like Devi was saying, how we live in the world affects our body. I believe everything that happens to us and how we integrate it, how we assimilate it, not just the food, not just the drink, but anything that happens to us in life, how we assimilate that. It's written on the textbook of our body, the sacred vessel that we carry around so we can do our work in the world. So tending to this vessel is super important to me. And I think introducing people to inexpensive, readily available medicine is a huge part of how I practice, and finding ways to incorporate that into somebody's busy lifestyle is challenging, but it's doable. Start with the simplest and move from there. So that's about me. And I'm sitting in front of a patch of nettle. It's going to be the star of our show today. But I'm going to walk you around before we sit back here and talk to nettle, because talk about nettle, because I'm going to lose daylight here soon. And I want you to see I want to introduce you to some of the other plants that we're going to be talking about today. So I'm going to turn off the camera so you guys don't get dizzy while I'm walking around, and then I'll turn it back on when I'm in front of a plant. Here we go. All right. So I'm going to walk over. This is in my yard. And if you have a yard, or if you have a patio with flower pots, you can grow a lot of these herbs, and tend to one or two that call your name and feel like they fit you. And then you can have medicine readily available at your fingertips. So,
Colleen, make us dizzy.
Yes.
Make us dizzy.
You want to be dizzy?
Make us dizzy.
All right. Let me see. Let me turn the camera.
We're gonna get confused, Michelle.
Yeah, I don't want to make a mistake. All right. See this patch here? I know you guys know this plant. In the wintertime, people take this plant. It's not blooming yet. It looks like a weed, doesn't it? It's in my wild, wet, marshy backyard. Look at all that water down there. It thrives and it grows wild here in Maryland. Sorry to make you dizzy. Okay, here's a beautiful specimen of it. Anybody know this plant? They can put it in the chat. I'll get closer so you guys can see it. See that leaf pattern? It's a tall shrub or a short tree. This is elder, Sambucus nigra. And most people are used to taking the berries, which are super good medicine for the immune system. If you have a cold or a flu, they're full of flavonoids. They help with the allergic response too, as DV was talking about. But a lot of people don't know that you can use the flowers. And actually, I love the flowers even more than the berries, if that's possible, because I love the berries. There's a lot of folklore around this medicine. In European herbalism, my ancestors come from Poland and Sweden. They talk about if you ever have a problem and you haven't been able to come up with a solution, you can sit under an elder tree and the answer will come to you. There's a lot of magic associated with this tree, a wisdom tree. But anyway, the elder flowers are amazing for sinus allergies, specifically in upper respiratory. It helps reduce the histamine response in the body, and it's also full of flavonoids too, just like the berry. And you can use it as a tea. You can use it as a cordial. You can make a lemonade out of it. I make every year. They should be blooming in about 2 months. And it's super easy medicine. And actually, when I was driving on the Beltway today, going to College Park, I saw a wild elder on the side of the road. So it's easy to find. All right, I'm not gonna make you dizzy, Michelle, sorry. I heard a complaint, so, or a concern.
I'm just joking. Go ahead with the flower.
Okay. All right. All right. Next plant we're gonna come to is, this is a super easy one to grow. And let me see. It's also good for the, there's so many plants that are good for the histamine response. So DV was talking about the immunological responses in the body. You know, you have the offender coming into the body, then there's an immune response, and then the mast cells are responding to that also. You have a histamine response, and a lot of herbs help reduce that histamine response. All right, let me see. All right, here we go. Can you guys see this patch? This is Monarda, sweet bergamot, or bee balm. This is great for the bumblebees. They love it. And it's going to grow really tall. It can go up to 5 feet tall. And this is before it's flowering, obviously. And you can see it has opposite leaves. Can you guys see it? And I want you guys to learn a little bit about plant identification, but I'm not going to go too much into it because we're running out of daylight. But this has the same benefits as thyme. It has thymol in it, which is good for the immune system. Boy, I'm out of shape because of this COVID. I haven't been moving. I need to take your class, Michelle. But this is a warming decongestant herb. So if you get a lot of sinus congestion, this plant can help you move and release that congestion in your sinuses. It's amazing. You use the leaf and you also use the flower, but mostly the leaf. All right, let's go to the next one. And you guys can put questions in the chat if you have any questions. And this is another one that a lot of people cook with that also helps in the mast cell stabilization. So as an herbalist, when I'm thinking about how do I support somebody's immune response if they have allergies, what do I do? First of all, like Dee said, you got to focus on the gut, and digestion is super important. But I also think about how do they assimilate? You bring things into you all the time. You bring food, you have to assimilate it, you have to take the nutrients out of it, make it part of your body, and then you have to eliminate the waste. The same thing with all the experiences we have. We have to assimilate them. They become part of our tissue, and herbs can help with that also. Say, like Dee talked about, trauma. Herbs can help with trauma. But this plant here, you saw Marta. Okay. Hey, Tom. Oh my goodness, I haven't seen you in a long time. Can you guys recognize this plant? It's very aromatic.
Rosemary?
Yes. Rosemary for remembrance. So this is a cerebral circulating herb also, circulatory herb. It's good for brain function and focus and concentration. You can put a sprig behind your ear if you're going in to take a test or if you're doing it remotely these days. But it also is a mast cell. It blocks mast cell release in the body. It helps modulate that release. So this is a great thing to add in your teas before allergy season or during allergy season. So you might say, oh my goodness, I'm just going to take some rosemary tea and that's going to help me. Well, not quite so simple. As an herbalist, I'd want to know more about how do the symptoms show up in your body? What's your constitution? Are you a wet person? Are you a dry person? Are you, we think of tissue states and we think of energetics in Western, well, all herbal traditions have an energetic model that they follow. In Western herbalism, we think of the tissue states and the energetics. So and the tissue state would be what's happening right now. Are your tissue state, is it wet? Are you a person who has leaky, constant postnasal drip and sneezing and watering eyes? Then we're going to use herbs that are drying for you. Are you a person who gets a lot of congestion? We're going to use those warming herbs like the bee balm to help break up that congestion, and also the pungent herbs like horseradish and garlic and ginger to help move that congestion out of your body and remove all that dampness. So I'd want to know, are you a damp person? Are you a dry person? Are you excessive or are you deficient? And then I would look at herbs to help support those processes in your body and not just look at the symptoms, but how the symptoms show up in your unique body. All right, there you are, rosemary.
I have a question about rosemary. I put it in the chat.
You put it in the chat? Okay. Is that Michelle? Can you read it to me? It's hard for me to see.
Oh, no, it's Takitha. Takitha was asking if you could make a steam from rosemary for your sinus.
Yes, definitely. So that's the great thing about herbal medicine. You can drink it as a tea. You could take it as a tincture or capsule. You can take a bath with it and you can do a steam with it. Rosemary with some eucalyptus. Think of pungent herbs that have a lot of volatile oils. So you could use rosemary, you can use eucalyptus, you can use mint. Mint, by the way, is also a mast cell stabilizer in the body. So that's a very common plant you can grow in a pot if you don't have a yard and have access to that. But along with that, depending on how your allergies are, I'm talking mostly seasonal allergies here, you can take herbs that help modulate your immune system so your immune system isn't so reactive while you're managing your symptoms. So we want to remove the harm. and we want to modulate the immune response, and then we want to manage the symptoms. So we want to always support the vitality of the body, and and doing those three things can help support your vital life force, because really the body is intelligent and the body knows what to do if we remove the harm and we give it the tools it needs to heal, and it can do that by itself. And I think plant medicine is a great partner. They're great allies to help our body reconnect with that innate wisdom it has, so it can heal itself and we can live more comfortably in these bodies of ours, because we're going to be in them a long time, hopefully. All right, here we go. Here's another one. Nothing's flowering right now. Does anybody know this one? I'll give you, go ahead.
Is that dill?
It looks very much like dill. Good guess, because it has the feathery leaf. It smells like apples. Good guess.
Yarrow.
It looks like yarrow. Yep, it's not yarrow though. This is chamomile. So if you have, yes, this is chamomile before it's blooming. It smells amazing. It smells like apples. So this is great for children, because this also, especially if they're a child who's kind of weepy and clingy when they get sick, you know, we all have our ways of responding to illness, and it's really easy to see patterns of response to the environment when we're younger, right? If a parent's really watching and says, okay, this is my child's constitution, this is how they respond to what happens to them, and you can help strengthen them by conversation, obviously, by parenting and health parenting and self-awareness, and tools like we talked about, like meditation and movement, healthy movement, like Michelle talked about. And you can use herbs to help them with that. And chamomile is really specific for that weepy kind of person, not just children. Some adults of us are weeping and complaining a lot. Chamomile is wonderful for that kind of constitution. And you can use this as a tea. You can also use it as a steam, and especially safe and gentle for children. Questions about the chamomile? I heard a big yawn.
Sorry.
No, that's okay. It's been a long day.
Wake up.
This is playtime. All right, we have two plants here. Now, I know it's not really fair. I'm asking about these plants that aren't flowering yet, but this is a very, very common plant. We use this mostly, it's great for so many things, but in, you know, traditionally, how it's marketed is for acute infections like cold and flu. Yeah, Echinacea. Thanks, Sarah. Yes, this is Echinacea in the early stages of growth. And here's a little flower that's getting ready to come up. You can see it here. Can you say that? I've got so many. Let's see. There we go. All right, it's getting ready to flower. Obviously, it grows tall. But you know what? Most people use the root, but the leaves are great. You can put them in your smoothies. You can juice them. They're really good about cleaning out the lymphatic system. So if you, I'd like to do that in after every season. I do a little mini cleanse in the wintertime, especially things are sluggish and slow and cold. If I have heavier foods during the wintertime, in the springtime, I start doing things to move the fluids in my body. I'll work through the blood and I'll work through the lymphatic system. And Echinacea is one of the ones I put in my smoothies in the morning, or I will juice Echinacea leaves to help move my lymphatic system. And it's very nourishing. And this one right here, I want to show you guys. A lot of plants that we use are drying and astringing, but except for this little one here. And I know you guys know this one. Anybody want to tell me what this plant is? It's a violet. So if you have this in your yard, save the flowers. You can make a cough syrup from them with the leaves. These are very moistening, but they're also great for the lymphatic system too, lymphatic congestion. Actually, traditionally in Western herbalism, people used to use these to treat lymphatic cancer and breast cancer. You would really have to have a lot of high doses of this to work that way. And I don't work exclusively with herbs and cancer, but because I think we need both Western medicine and herbalism, but that's just the history of this beautiful plant. It's moistening and nourishing to the body. So it's great to add in formulation with herbs that are drying, like the nettle, which we're going to talk about in a bit. All right, a couple more, then we'll go make some medicine. All right, who was talking about yarrow earlier? This is just a really rough patch. I had it cleaned out because last year it was so densely congested. The plants were fighting for space and I wanted to give them a little space. That's why there's so many bald spots here. But this is yarrow. Botanical name is Achillea millefolium. You can see these leaves are fern-like, pretty similar to the chamomile. Millefolium means thousand-leaved. A lot of legends about this plant too. It's named Achillea millefolium. It's named after the Greek hero Achilles. The legends say that his mother bathed him in the river Styx that had a yarrow growing in it, and it made him invulnerable, except for she was holding him by his heels, and that was his weak spot, and that's why we call it our Achilles heel. That's our vulnerability. Yarrow is great also for springtime or even fall seasonal allergies where you have that drippy runny nose. It's drying and it's warming. But this herb is just amazing because it's what they call an amphoteric. So in herbalism, we think of the properties that the plants have. They have so many chemicals and so many possibilities of how they can be used in the body, but we break them down into categories to help us understand them and use them in a way. But most of them cross many different action categories. And this plant is considered an amphoteric. And what an amphoteric does is it responds to the needs of the body. So if the body needs to move blood, it'll help move the blood. If the body has too much thin blood and it's moving too fast, it will staunch that bleeding, or it'll slow that down. So what are some symptom patterns you can use it with? I'm just thinking of specifically something that if somebody has a bruise and they want to heal that, I've used this, on topically for wound care. They need to move that blood because it's stagnating and it's pooling, and it can inhibit healing. You can make a poultice or a compress of yarrow leaves. You mash them up to release all the juices, and then you apply that to the tissue, and it can move the blood. Yarrow is also really well known for staunching bleeding. It's called, one of the common names that the native North Americans used to call it is nosebleed. And it was good. Of course, I don't know the language, but anyway, in English, it translated to nosebleed. It stops bleeding. So it's called a styptic. So you can use it if you have excessive menstrual cycle. You can use it in partnership with other plants. It's better to formulate with it rather than using it as a simple. But also if you have a nosebleed, especially due to allergies, you can crush up yarrow and place that inside your nostrils, or you can do a nasal rinse with the tea made from yarrow leaves or flowers. We use the flowers and the leaves, mostly the flowers, but we have leaves right now. And then you can make an infusion of that and use it as a nasal rinse. So it can really help that dryness in the tissue and bring moisture to the tissue and staunch any bleeding that you have. So you can see I have mint growing through here. Let's see. You have, okay, dried herbs versus fresh. So most plants, if you have them fresh, it's better to use them freshly harvested, but we don't all have the access to that. So what I say is if you have dried herbs that are kept in a cabinet out of the sunlight, they usually say they last about a year, and then you use them up within a year and then replenish them. They lose their vitality the longer they've been exposed to the air and the longer they've been sitting. If you have a powdered herb, that lasts usually about 6 months. So you have to think about that. One herb in particular, lemon balm, which is also really great for kids for seasonal allergies. It can help them manage those symptoms. It works so much better when it's freshly used, but you can make a fresh tincture out of it or a fresh glycerate, and that preserves those volatile oils for those fresh plants. So say you don't have access to a lot of fresh plants, but you belong to a neighborhood urban garden. And so you can go harvest the plants there and you can freshly tincture those plants, or you can juice them and you can put them make in ice cubes and put them in your freezer and use them as you need it. Does that answer your question? How about herb barks? They're about the same. I would say about a year, maybe 18 months. Depends on the volatile oils and the properties in the plant. They just start losing different properties depending on the instability of those properties in the plant. And last one before we go back to the nettle, my battery looks like it's about ready to die. We have oregano here. About nettles and whether
Colleen, you went on mute. She might be getting a call or something. Colleen,
Such
can you,
fluid.
there you go. Colleen, we didn't hear anything you said just now. Or she might be frozen. Colleen, can you hear us?
I'm here.
She's got two devices on.
I'm shutting down. I had left my phone outside when DV was battery.
Okay.
Went dead. I'm back.
Okay.
All right. So I saw a question about the nettles. I'm going to bring you back to this beautiful patch of nettles here. All right. Who had the question about nettles? Michelle? Do you see that?
I don't remember. I'm gonna have
Whether
to
they spread
I'm trying to
aggressively.
find
Yes.
this,
They also spread. They do. I mean, I've had this. I mean, this is a patch that's been here for about 5 years, and that's as far as it's gone. I started with a little plant like this. So, I mean, I harvest it regularly. So if you harvest it and you cut it back, it won't, you can keep it contained. But it is one of those wild plants that does spread. It's not, I don't think it's as bad as mint though. So this is Urtica dioica, stinging nettles. And we use this whole plant. It's such amazing medicine. Some people think it's the most nourishing plant in the world. Many places around the world have a type of Urtica species growing in their region. It's full of minerals. I'm touching it because I'm used to it. But if you do touch this, it has hairs on it. They're actually like hollow, like hypodermic needles that have formic acid in it and other acids that sting you. Let me show you guys. They hurt. But native peoples from many different cultures would do what they would self-flagellate with this plant to cure arthritis and gout and those kind of accumulation diseases. They would whip their skin with it or rub it on their skin, their joints, to help create a healing response in the body and move that blood, move that circulation so the body can get rid of those metabolites that are stagnating in the tissue, in the joints. So it's has a purpose. You can use it topically, you use it internally. We use the root for benign prostate hyperplasia. It's amazing for that. We use the leaf and stem as a nutritive tonic. It's an alterative, meaning it helps the eliminatory organs get rid of waste. People would they used to call it a blood cleanser. Alteratives used to be called blood cleansers. But now we know that alteratives work through the eliminatory organs, helping them eliminate waste and do their job better so they can increase their nutrition. We can increase our nutrition in the body. So the great thing about nettle is it is an alterative to eliminate waste, but it also is a nutritive. It's full of calcium, magnesium, protein. It helps us assimilate proteins better. It's just a phenomenal plant. And then we use the seeds. So we harvest it before it flowers or else it'll be really bitter. But we use the seeds for kidney insufficiency. I've used it with a client who is going into kidney failure, along with some other herbs and other lifestyle changes. But it really helped nourish his kidneys. 5 years later, he's still not on dialysis as he's following his herbal protocol and his lifestyle protocol. He did become a vegan, and he was a 77-year-old man who had rheumatoid arthritis, COPD, he had a history of bladder cancer. He had to self-cath 3 times a day. He's an amazing man. He turned his life around at that age, and he's still doing well. And he's about, I think he's maybe about 83. I think he just turned 83 this year. So it's phenomenal plant to help restore kidney function. We used it in partnership with cordyceps and some other herbs that are specific for kidney insufficiency. But this was the main one we started with. So how do you use nettles? You can make the seeds into a tincture. You can eat them as a vegetable or a seed like flax seeds or milk thistle seeds. You can just harvest them in the fall. Usually it's about September, August and September, they start going into seed. And then you store those seeds. They produce a lot of seeds. And you can just take it, if you want to protect your kidneys or you want to restore your vitality of your kidneys, which, in Chinese medicine, that's where we store our jing, our life force in our kidneys and in our reproductive organs. And nettle seed helps nourish that part of our body. So it increases our vital force in our bodies as we age. So it's an amazing plant for that also. So you can take it as a vegetable. You can saute it. You can
blanch it and eat it as like spinach. You can put garlic in there and olive oil and some lemon, or some, you can make a medicinal vinegar and help to absorb the minerals more with this plant. You can also make a overnight infusion. So that's the best medicine to take if you are a person who has allergies, seasonal allergies, and you don't want to take capsules, is to take an overnight infusion of nettles. You would use about half an ounce to an ounce of dried nettle to about 4 cups of water, and you would just steep that overnight. And the next day you would just drink it. And so the best time to do that, though, is to do it before allergy season hits. Whatever season you have allergies, start about a month before you have your allergies. And then you start taking the nettle tea. You can do 1 to 3 cups a day, depending on how severe your allergies are or what your body constitution is. If you are a dry person, you would use less nettle. If you are a person who's robust and you have a lot of fluids in your body, you could use up to 3 to 5 cups a day. Just always listen to your body. You want to use the lowest, most effective dose when you're using herbal medicine. If you only need 1 cup, just take 1 cup a day, and that's the medicine you need. If you need more, then you would take more. And this is just something you have to experiment with and know your body and see how you respond to the medicine. Always pay attention. If you start to feel dry, because it can cause dryness with long-term use, tissue dryness, and we don't want to go into tissue dryness because that can cause inflammation in the body. And the mucus secretions help protect our tissue, so we don't want to dry that up too much. You can incorporate marshmallow root into your diet, into your herbal infusions. You could bring flax seeds. Flaxseed tea is one of my favorite ways to bring moisture back into the body. Take fish oil or omega-3 fatty acids. You don't have to use fish. You can use flax seeds. You can use borage seeds, which are amazing. Evening primrose oil. Those are all wonderful ways to bring moisture back into your body. So any questions about nettles before I move from this baby?
There are lots of questions happening here, multiple questions like recommendations for kids with allergies. Do you recommend nettle leaf extract? Yeah.
Let's start with the kids. So are you talking about seasonal allergies for kids? You can use nettle leaf for seasonal allergies with kids, and raw honey. I would use raw honey with that. Unless they're vegan, then you just would skip the raw honey. But you can use nettle leaf extract, definitely. You would just start with a lower dose for children. So if I had a robust adult and I was recommending an ounce of herb, have them making overnight infusions, 3 quarts a week, that's basically 2 cups a day. I would have a child do 1, depending on the age of the child. If they're over 8, you can, we usually dose lower, 8 years old and younger. But if they're over 8 years old and they're a robust child, you can give them like a teaspoon to 2 teaspoons per 8 ounces of water. Boiling water, and you let it steep 30 minutes or so. Or if you want them to have more minerals, the way to extract minerals from plants is either by making an herbal vinegar or making an overnight infusion or infusing them for a long term, anywhere from 4 to 12 hours. That extracts minerals from the plants. So it depends on what you want to do for the kids. So the minerals will help with the immune response, so they're not as over responsive. So I think that's a better way to do it, is the overnight infusions. And then you would just give them a 1/4 cup, once or twice a day. You can dilute it. You can put it in, make popsicles with it. You can put in ice cubes and find creative ways to do it. You can put it in their soup, put the nettle infusion into the soup. I love vinegars because you can, if people eat honey, you can make what are called oxymels, and you make an herbal vinegar by putting the herbs in a jar, covering them with raw apple cider vinegar. You let it sit for a month, you strain out the herbs, and then you can add some honey to that. And that's an excellent way to get minerals into the body. And then you're also getting the properties of the plant that helps reduce the allergic response. You're getting both of those things. It's easy, inexpensive medicine. It's tonic medicine, things that you can use to build the body and nourish it so it can do what it knows to do. Another herb you can use that also helps with mast cell response in the body to modulate that is catnip. And that's a wonderful plant for children also. Most kids really like it, especially if the child also has a lot of tension in their stomach. If they're the child, when they get nervous, they have a lot of tension in their stomach, they get a stomach upset. I would use some nettle with catnip, in partnership with catnip, and that can be a really good medicine for children. Again, start with 1 cup a day, depending on the age of the child. So I did talk about this plant as being drying and also more for the robust person. But on the other side of that, this plant is really, really great for people who are feeling weak and deficient, and they're recovering, they're convalescing from stress, from long-term health issues, long-term exposure to allergens, and it's just depleted their body. So we think about, tissue representations or constitutional representations when they come into practice. Is the person deficient or are they excessive? If they're deficient, nettles can also really be beneficial for them, but you would just use it in formulation because it is considered a blood builder and also a muscle builder. So it's great for elderly people because as we get older, we have muscle wasting kind of disease, and nettles can help us assimilate the proteins from the foods we're eating, whether it's lentils, legumes, whatever we're getting our protein from. Nettles can help us assimilate and break down those nutrients so our tissue can be more vibrant and be stronger. So it's great for both picture constitutions, but the medicine is in the dose. So just to repeat that, if it's a robust person who's fiery and who has a lot of heat in them, nettles is really great for them at higher doses. If it's an emaciated person who's convalescing, who's more thin and dry, you would use nettles in formulation with moistening herbs like the violet or marshmallow, or the essential fatty acids like flax tea, and you would use it in lower doses. So it's good for both spectrums. It's a cooling herb, it's an astringent, it's an alterative, it's a tonic, and it's just an amazing plant. It's a tissue builder, so I just love it. It's one of my favorites. Any more questions?
People are asking, and maybe I missed this part, but when do you start the infusion of the nettles? Do you start, how long before allergy season, and do you continue it throughout the season?
Yes, I would start it 1 month, about a month before. So if you know your body, you know, okay, in the springtime, I know, starting in March, into March, I'm going to have my allergies. What I like to recommend to my clients, especially if they don't have a very clean diet, is that they go on what I would call a mini cleanse. So at the change of the seasons, I think it's a great idea as a time to reset our bodies and to get them ready for the new energies that are out in nature, because, we are a part of nature. Our bodies are in the same kind of rhythms that nature is, even if we don't live in that environment anymore. Not many of us are living outside in the woods, but our body still has that pattern to it. And so depending on our constitution, we're going to be reactive to that season. So if a person at their allergy season, usually it's at the change of the seasons, right? So in February and March, they know the symptoms are going to be coming up. So start your teas in January and February, and to help your body. And when March comes around, I like to do it at the equinox, which is around the 19th to the 21st, go on a 3-day mini cleanse. Maybe it's a mono diet. Maybe you do a khichdi diet, which is an Ayurvedic practice. Maybe you do something, maybe you just eat simple foods that day. Maybe you're only gonna eat vegetables for those 3 days. And bring in your herbal alteratives so they can help cleanse the blood, cleanse the body, and get it ready for the new season. Makes you stronger to meet what's happening outside in the world. So in the fall, say somebody has fall allergies, and DV talked a lot about ragweed. One of the other plants that blooms at the same time as ragweed is called goldenrod. And a lot of people think of goldenrod as the one that's causing their allergies, but it's really actually goldenrod is the remedy for the allergies in the autumn in particular. You can use it in the spring too. Goldenrod is solidago is the botanical name, and it translates to make whole. And that plant is so amazing for so many. I don't have it growing here, obviously, and it blooms in the fall, but it's golden yellow flowers on a tall bract, and has alternating leaves. And it's kind of resiny and a bright and an earthy flavor at the same time. We use the aerial parts, we use the flower and the leaves. And that's another one you can do as the autumn, if you have autumn allergies, is you work with the solidago with the nettles to help with that time of year. So if September is your time, then start taking your teas in August. Does that make sense? Okay, any more questions?
First of all, as your girlfriend.
Yes.
Because I know you're recording this, or you want to record this, and we're recording this. Most of this video is your nose.
I don't want
and you're showing us the herb, right? And your face is so beautiful. And so
Thank you, Michelle.
Just so you know, so you don't come back to me later like, girl, why didn't you tell me that
Thank you.
you were just looking at my nose, right? So secondly, and I think this is important to know or not, because I know Takitha likes to experiment. Takitha wants to know if she can bathe with nettle,
What, she can bake with it?
if she could take a bath with nettle.
I would not take a bath with nettle.
Yeah.
And why would you, do you have a skin condition that you would want to take a bath in it? What, any particular reason?
No, I was just asking because I know that I take baths. You can put ginger in your baths and you can put mint in your bath. Certain herbs you can,
Yes.
certain things you can put in, like for detox and things like that. That's why I asked about nettle, not the stinging kind.
You know, I'd be curious. I mean, I wouldn't. So I think there are other herbs that are more supportive for that, for healing and cleansing the body through the skin in a bath. I mean, you probably could try a tea, and I don't know. If you're going to try it, start with your hand first, or put your forearm in there and make a tea, and then strain out the plant and see how it responds. I don't know if that would be a good idea, because when you blanch it, when you boil it, you're taking the histamine out. You can try it, but just start with your forearm.
Okay.
I would prefer, if you're trying to do a cleanse, I think seaweed's a better cleanse than nettles would be in a bath.
And just so you know, I would put it in like a cloth bag, steep it separately, and then pour that in the tub, not put the herb itself in there.
Yeah. Yeah, I mean, so like I said, people do self-flagellation, but I think immersing your whole body at once might be too intense.
Okay.
I would caution against that.
I'll try it little by little. Thank you.
Let me know.
Okay.
So Regina, what, do you have a question?
Yes, I don't know how to not. Oh, there we go. Okay, lower my hand. So yes, I did have a question about the herbal infusion. So with the infusions that you make, do you have to keep it? Can you hear me?
Yes.
Oh, okay. Do I have to keep it refrigerated overnight in the or do I have, like, can I set it on the counter at room temperature?
Colleen, I'm sorry. Colleen, where'd you go?
I'm here. Sorry, did I mute it?
Yeah.
Okay, I set it on the counter at room temperature.
Okay, thank you.
Okay, good. And then Angel, I know all of y'all have a lot of questions, and I'm hoping that some of the answers will overlap, and then it'll help, because it's impossible. We'll be here till tomorrow morning, answering all your amazing questions. So, Angel.
Yes. So touching back on autoimmune diseases, what are good herbs for that, especially specifically for the autoimmune disease that attacks the nerve system?
Okay, so herbs that are good for autoimmune conditions are immunomodulators. And so there are a lot of herbs that do that, but you would need to formulate for the person specifically. And I know I got my nose again. You would need to formulate for the person specifically. So again, I talked about constitutional, the constitutional presentation. How is it showing up in your body? Which system in the body? You said the nerves. Are you talking about something like MS?
It's something close to that. Yes, I believe.
Okay. So. Okay. So you would work with immune modulators based on the constitution of the person. So one of the safest ones that I like to use, that's safe for most people to start with, is astragalus. DV talked about astragalus. It's an immune modulator. It's also, some people consider it an adaptogen. It's very nourishing and building to the body. And an immune modulator, what it does is, again, like I talked about Yarrow being the amphoteric, responding to the body's needs. If the person is excessive, they're hyper responsive, like an autoimmune disease, then the immune modulator will help calm that response. The body's not attacking the tissue so aggressively. And if the person might be under functioning in the immune system, like they have chronic fatigue syndrome, if you think about the picture of a person with chronic fatigue, they don't have any energy, they're deficient, they can't get up and go.
the immune modulator plant would stimulate that that immune response a little bit more. They might have a heavier viral load. The immune system, the immune modulator will kick up that immune response, so they can kick up the immune response to get rid of that excess viral load. You would also need to use nourishing tonics with that person, and then things that would work on that specific organ that's being attacked. So, you know, there can be, you know, to testing for autoimmune disease, they do a systemic test. Is there a systemic autoimmune response? And then they'll do a diagnosis based on that, but also which system of the body is being attacked. So other herbs that can help support the nerves are St. John's wort. It's a tonic and what we call a tropho-restorative for the nerves. But that one has some cautions to use. You can't use it with certain medications. So you'd have to work with an herbalist to talk about that, or do some more research on your own, because it works so, it's so effective on the liver, but it can clear the medicine out too quickly of the liver. And then you would not have a regular dose of that medicine in your body. So St. John's wort you have to use caution when you're using St. John's wort. But if you're not on medication, it's so wonderful about repairing nerves in the body. Another one that has minimal side effects or cautions is oat straw or milky oat top. It's slow working, but it's something you take for a long period of time to restore and replenish the nerves in the body. Goldenrod is another herb I like for the nervous system. I think of it more as a responsive for anxiety, but in Ayurveda, it's considered a rasayana. It's a rejuvenative tonic for the whole systems of the body. Goldenrod, especially if there's issues with the capillary, poor circulation, or they have a hard time focusing, and they might have a lot of anxiety or a high startle response. That they're nervous and they get loud sounds, or flashing lights might disturb them. I might use Goldenrod for a person like that. Does that answer your questions? Any more questions about that?
Thank you so much.
You're welcome. Good luck.
How about if someone's asthma is triggered by allergies, how can they calm, excuse me, how can they calm the respiratory system?
So asthma in particular is, it can be a scary one because it's life-threatening. It can be life-threatening. And so I always tell people who have asthma to keep their inhaler with them, because you need that rescue inhaler. You know, DB talked about the allergic response, and, you know, sometimes it's life-threatening and sometimes it's not. We can modulate with herbs if it's not life-threatening. I would work with asthma in more of a tonic way and to support the vitality of the system. I wouldn't use herbs as emergency care for asthma. Having said that, if you feel a little catch and you feel like something's coming up, but you're not having an asthma attack, you can work with Kella. Ami Visnaga is the botanical name. It's an amazing plant. It also works with mast cell stabilization. But it also is a bronchodilator, and it's an antispasmodic, so you can breathe easier in the body. So it works in the physiological aspects of the body that way. Another way to help manage asthma, if you can feel that catch and you feel like it coming on, is to do breathing practices. And Michelle might be able to help you with that. And to learn how to go inward and to quiet the body's response, and to know when your triggers are coming up, and use that practice also, because you can take that anywhere. If you forget something, my son had asthma when he was growing up. When he was 13, he was diagnosed with celiac disease. But he did learn over time how to manage his breathing instead of having a lot of fear around it, which of course the fear response makes the breathing more rapid and more shallow, right? And that just exacerbates the asthma. So there's a lot of different things you can bring in to be the medicine to support that, that process in the body if you're having asthma. When he went gluten-free and dairy-free, 9 months later, he's not wasn't using an inhaler anymore. I still tell him to keep his inhaler anywhere he goes. He's 27 now. I think just keep it just in case. He's on his own. He's not going to eat the food. He's not eating the food I recommend for him, and he's not going to take his herbs with him, you know, to his job. Oops, got to take my tincture, my mom said. So, you know, I tell him, keep your inhaler. You know, he's not at the place where he's doing that. So you want to preserve life first. Always preserve life. And then support the vitality of the life while you're using pharmaceuticals. So use things to build and nourish and to slow down that excessive response that the body's having. Any more questions about that?
So did you have something that you were going to show us in the kitchen?
Yes, I did. Do you guys, it's late though. You guys want to watch how to make some nettles? So one of my favorite, I'm just going to show you the ingredients and how to do it. Okay. So when you're making nettles, I've got this water already boiling. I talked about blanching it, right? So I've got the water boiling and I'm going to put some nettles in there. I'm going to take these stems off. I should have done that when I was harvesting. I won't do it now. I'll just so you guys don't, so I don't take up all your time. So you put the nettles in the pot. So I'm telling you, as I'm doing this, this plant is stinging me. It feels like fire ants are stinging my skin. Seriously. So I'm telling people say to use gloves, but every time I use gloves, it's very awkward and cumbersome. I can't get my hand around the plant. So I just take the sting because I know the plant's helping me. So I just do that. But I just want to warn you, if you do this on your own, your hands will sting tonight and tomorrow they'll feel numb and tingly. But I feel like that's increasing my circulation and I'm willing to take that risk. So put them in the pot, boiling water just for about 1.5 minutes until they start to wilt. Okay.
Is there a reason why you take the stems off?
Because I just think they're woody, too woody in the recipe.
Okay.
So I'm going to make something. It's like a pesto. This is like this is an old recipe called from the Latin culture from Rome called a moritum, which is basically a pesto, but it's a cheese and a lot of herbs. And I made a cashew cheese to go with this. And I think this is a great way to get greens into your life when you get bored of having kale, you get bored of having spinach, to spice it up a little bit. I've got cilantro, nettles. I'm using celery and celery leaves. You can use lovage if you have lovage growing in your yard. I don't see that at the grocery stores. I have some onions that I pulled from my yard. This is wild onion grass. If you have a lawn, this is probably growing in your grass. You can use this like an onion, and it's a lot more pungent than regular like green onions, you know, that have been cultivated on a farm. Lots of garlic, and then the nettles. So when they're finished boiling, you're going to boil them, like I said, for about 1.5 minutes. And then I'm going to put them in ice water, which I already have in the sink. While that's doing that, I want to show you guys this gorgeous, gorgeous cashew cheese. Isn't this beautiful? You guys, anybody ever made cashew cheese?
I haven't, but that looks lovely.
It's amazing. You know what you do? This is about 1.5 cups of raw cashews. You soak them overnight in water, strain the water out, puree them in the blender with some nutritional yeast, some lemon, apple cider vinegar maybe, and a little bit of salt and pepper. And then you puree that in the blender. I put it in a cheesecloth, squeeze out all the liquid, and then I have cashew cheese. It's amazing. You can put chives in it, but we're gonna put these herbs in it.
Wow.
Whatever you want to do it. It's amazing. You can put dried cranberries and black pepper and spread it on crackers. It's really delicious.
Yeah, she needs to show up her own, Michelle. I'd sign up.
You can make a cashew cheese cake. You want to sign up? We'll do some cooking. I'll promise I won't show my nose so much. All right, so it's boiling. I hate to throw out the water, so I'm going to put it in a bowl so I can drink that later. See? No.
We love your nose, Colleen.
Right, it's a cute nose. But
my Polish nose that my dad always teased me about, my Polish nose.
Your girlfriend always has your girlfriend knows you. And
Thank God you said something. Okay.
So when you strain that, is it gonna? When you cooked it, is that make it so it's not gonna sting you anymore? Or
yes, that's to take the sting out. It
okay.
has, yeah. Hold on.
And so when you harvest herbs, can you just harvest them from anywhere, like the side of the road, or?
Thank you for bringing that up, Michelle. It's super important to harvest in a clean place. You want to make sure, some plants really thrive in disturbed areas. They actually restore disturbed areas. Like on the side of the road, if there's been erosion, there's a lot of plants that bring their nutrients and they help heal that earth. But we don't want to take that as medicine. Plants are so amazing. I mean, they have an adaptive response. I'm sure you guys have heard of adaptogens like astragalus. We were talking about that. Some plants live in really awful places, but the plants have a chemical response
to learn to adapt to that environment. And then when we take those plants, we get those properties that the plant has created inside of its own body. So they're amazing, like rhodiola that grows up in Siberia in the really cold, arid areas. It's really strengthening to our bodies because it's worked to adapt to its environment. But when you're harvesting plants, make sure it's not next to runoff, next to a street. Make sure there's plenty of plant available. You might want to watch the area like through a whole year first before you start harvesting. Maybe you go to a place that you love to hike and that you're able to harvest. You want to make sure there's plenty of that plant before you take it. If there's only 1 to 2 plants, don't take it, because I think I have a responsibility as a steward of this earth, not to continue to take and take and take from the earth, not being thoughtful about how I affect the environment that's around me. Because I think as humans, we do that. We're so human-centered, and I like to wish we could move to a place where we're more geo-centered, we're more earth-centered, and we think about the other living beings on this planet besides ourselves. We're not the most important thing on this planet. We're causing the most destruction. And so when I harvest out in the wild, I try to be mindful of that I'm not going to continue to take and take and take, and that I only take like nettle. If there's nettle growing wild, that plant is very hardy and it spreads all over the place. I definitely would harvest that plant. Maybe take 10 to 15% of the plant, depending on how much is there. Now, if it's a plant that I need to harvest the root, I'm going to put this in the blender. That I have to harvest the root, like black cohosh. I have that growing in my front yard, but I don't harvest that plant, because if I harvest black cohosh, I have to take the root, and that takes the whole plant and it kills it. Black cohosh is an endangered plant, so I don't use a lot of that plant, but I have it in my garden just to honor it and keep a safe space for it. Another plant that you take the root, or it's called the rhizome, which a rhizome is something like this. This is a little bit different than a root. This is turmeric, and it's considered a rhizome. This is ginger, it's considered a rhizome. If you see the little hairs that come off it, those are the roots. There's a plant I have growing in my yard that I do harvest that you take the rhizome. It's called Solomon seal. It's really good for hot, dry, inflamed conditions, like if somebody had rheumatoid arthritis, or if they had even osteoarthritis. It's nourishing and building to the joints, and there's a lot of heat. Or if they have lupus and it's a hot, dry pattern in their body, moistening, cooling Solomon seal works great. And so when you harvest that plant, you just take part of the rhizome, and then the other part you can plant back in the ground. So it's important to think about how you're harvesting the plant. So thanks for asking that question. And I'm probably telling you more than you want to know. Speaking of mast cell stabilizers, see this plant here, turmeric? This is a mast cell stabilizer. This plant has so many chemicals in it that are so helpful for our bodies, but it's a hot, drying herb. So if you already have a hot, dry condition, don't take too much turmeric, especially with black pepper. I know that's the big thing people are doing right now, right? Which traditionally in Ayurveda, which is the system of healing from India, they use pungent, spicy herbs in combination, but turmeric is just one of them. They would use other herbs to help modulate, like you would cook it, and I'm sure you guys have seen golden milk recipes, right? Cook it in milk or coconut milk. Turmeric with black pepper. That milk, that fat helps mitigate the drying effects of the turmeric. So think about formulation and how you're taking the medicine, the energetics of the plant. And you can look up herbal monographs online and learn about the energetics and actions of these plants. It's also great for somebody who has issues with their gallbladder, where the bile duct might have obstruction. So you don't want to use too much turmeric for that. All right. Okay. So this is how you make it. You make it like a pesto. Traditionally, you would, put it. But you
tip your camera down, please.
Yeah.
Thank you. Look at all that we were missing.
This beauty. Okay, so here's my gluten-free little bread. I'm going to put this on, and we have the cheese. So you use a whole head of cilantro. I've washed this. You chop it. I don't like use the stems because it's too woody. 5 or 6 garlic heads, depending on what you like. I like 3 or 4 celery stalks with the leaves. Sometimes I'll put parsley in here, chives, and green onions. And I also use my wild onions from my yard. And then you puree it in the blender with some salt and black pepper. And then I mix it in with the cheese, the cashew cheese, because I try not to do dairy. I made this last night, so I'm not going to show you guys. I'm not going to turn on my blender. See my old Vitamix? This is what they used to look like back in the day.
This was my mom's Vitamix. This thing is 26 years old and it still works. I love it. My son wanted to get me a new one a couple years before my birthday, but I couldn't get rid of my old one. Okay, so basically it's like a pesto. I'm sure you guys have made pesto. You can make nettle pesto, you can make nettle and asparagus soup, but you put it in with the cheese. And then you mash it up and you use it as a dip. You can use it as a pizza crust. And I found this ancient recipe, this old recipe that's adapted obviously from ancient Rome. And if you think about the elements which are represented inside our bodies, but also out in nature, they thought of this round, flat piece of bread. This sauce is called the moritun, which is basically a pesto, you know, but it's not, doesn't have a nut base normally. It has a cheese base. I'm just doing a nut cheese. And you put it on this round piece of bread. And this is supposed to be, some people think this is where the beginnings of the Eucharist came, the sacred bread of Christ. This is pre-Christian times, but their round bread represented the cosmos. And it represented the elements in the cosmos. The grain is representative from the earth because it grows in the earth. The fire is how we cook the bread, and the air feeds the fire. And the water is the liquid we add here. So this is really symbolic food, ritual food, almost sacred food. And I love to think of food as medicine in all ways, not just nourishment for the body, but nourishment for the spirit. And then you put it on here, and I would heat it up because this is cold. I made it earlier today. This could be a really healthy snack. This is gluten-free bread. I don't eat gluten. I don't eat bread very often actually, but when I do, I like to have something delicious on it like this. I'll keep sauces in my refrigerator for quick snacks and quick meals when I get busy. I like to, make, on the weekends, I'll make several sauces throughout the week. You can do pesto with parsley and cilantro. You can do pesto with dandelion leaves and cilantro and nettles, of course. So that's my little dish for you guys. But I wanted to show you about making nettles. So say you don't have nettles growing in your yard. What are you gonna do? Tell me what your guys' stamina is. If you guys need to go, we can do this another time.
So it is 8:15, and we're online, so people could just dip out as they, that's the beauty of being online. I do want to respect Dushan's time. Is he still here? Yes, he is here.
Yes,
TV.
I'm here.
And so what I would like to do is go to spotlighting the both of you so that you guys can offer answers to, well, I'm looking for you. Say something, T.
Yeah, I'm here. I'm trying to get back to
the.
Yeah.
Can you talk right now, or do we need to wait?
No, I can you hear me?
Yeah.
Go ahead, Dee
Okay.
Dee. I know you're at work, so.
Yeah, can you hear me?
Yes.
Yes.
Okay, great. That was an amazing presentation. Thank you so much.
Yeah, it was really awesome. So the two of you guys did an amazing job, and believe it or not, y'all are asking for more. That's our plan. We wanted to see how this first one would go and see the response. It was an overwhelmingly awesome response. This is actually the second talk that I've done with Dee. In the beginning of the pandemic, he and I, well, he did all the talking. I just pushed some buttons. But you can see that on YouTube where he talked about COVID and your immune system and its connection to the chakra system. And so we will be doing more. And we are going to send out information for you guys. This video is being recorded. You will get a copy of this recording emailed to you, and you can share it with your loved ones. So this is the Q&A portion. If you have questions, you can type it in to the chat. And again, hopefully we can, everything is so informational. So if you guys want to ask a question, I will say it's too bad that Colleen doesn't live 5 minutes away, because that looks like too much food for her, and I'm hungry.
Come over and help me eat it because I have another batch in the fridge from I made some last night too.
So Leanne is asking, how does hormonal birth control affect your allergies?
I'll let you take that one, DV.
I'm sorry, I missed that. Can you say that one more time?
How does hormonal birth control affect your allergies?
So, okay. So number one, when you're using birth control, you're changing your natural body rhythms. Now, I recognize that there's reasons why people use birth control. So a minute about that. If you're using birth control for regulating your cycles or treating your moods or doing some medical treatment, then there are better ways to do it. Okay, it's just the reality. If you're using birth control for contraception, that's fine. I've got no comment on that. Got total respect for that. I wish every young woman and woman in general has access to birth control for contraception. Okay, so it's a disaster when used for medical reasons. It's great if you're using it for practical reasons. Now, when you change your body rhythms, you can't be surprised that at certain times of the month, especially when estrogen and progesterone are the most imbalanced, which is mid-cycle, you're having a peak of estrogen and there's not as much progesterone. And then right before you bleed, which is when there is a drop in progesterone. Same thing after you give birth, there's a massive drop in progesterone. Progesterone is an immune balancing hormone. So many autoimmune diseases go away in pregnancy, like MS and lupus, MS, the Th1 type diseases go away during pregnancy because of progesterone going up. So, and you see some people that have like healthy progesterone levels while they're pregnant. They're the people that say, oh my God, I feel so wonderful. They're glowing. They have weight gain just in their belly. It's just a sign of like a totally blissed out person. And even after the fact, years later, some women will say, oh yeah, during my pregnancies, I felt the best I ever had. And then outside of that, they feel so awful. So those are hormone balanced pregnancies where your immune system is really optimized. So there is an intimate connection between hormones and microbes. Okay, let me give you one example. If you take stool out of a woman, if you take a woman's stool and you transfuse it into a man's rectum, it's called a fecal transplant, you can increase the man's estrogen levels for the next 4 months. And then vice versa also. If you take a stool from a man, put it in a woman's colon, you'll increase testosterone for the next 4 months. So there's an intimate relationship between hormones and microbes. And the immune system is what we need to have healthy to be healthy, right? And it's beholden to the activity of microbes and hormones. And microbes and hormones have rhythms. And that's something that's really important. Now birth control will throw off those rhythms and you'll create a fake rhythm. You create a fake rhythm and when you're using birth control. And usually, if you're noticing infections certain times of the month, then chances are there's an estrogen progesterone imbalance that can be worsened by birth control. And that's why birth control in some people can lead to blood clots and other problems, because there's an already pre-existing hormone imbalance in you and you're worsening that with birth control. That's why in some people that don't have that hormone imbalance, they take birth control and they're fine. But if you have a hormone imbalance and you take birth control, that hormone imbalance will worsen. And then that'll throw off your microbes and that'll put you at risk for mucus buildup and you can get inflammation. And if it's IgE mediated inflammation, you'll get allergies.
So Selena was asking, does that drop in progesterone contribute to postpartum depression?
Major cause of postpartum depression, major cause. It's a major cause of postpartum cardiomyopathy too, because progesterone is not a sex hormone. There's plenty of progesterone in men too. You can't change your sexual features or your gender using progesterone. It's not like testosterone, which is masculinizing, and estrogen, which is feminizing. Progesterone is just a regulatory hormone. It's the regulator, right? It's like the Warren G of hormones. Oh, it's like maybe it's a Nate Dogg reference. Anyway, so Progesterone's job is to regulate testosterone. It regulates the thyroid. It regulates cortisol. It regulates estrogens. It regulates the estrogen receptor. So you lose progesterone, and then you're going to have immunologic problems that can manifest with allergies, mood swings, like postpartum depression, or it can manifest even in premature arthritis, and usually it throws off the thyroid. So whenever I see a patient with a thyroid problem, go to the estrogen and progesterone, check their autoimmune antibodies, and you balance those out and you see the thyroid get better.
So would that be why someone who did not have seasonal allergies before they had children have them after they have children?
Beautiful. That's such a good question. So I had this patient that told me, that she came to see me and paid our fees and all that just because she has a cat allergy to one animal. And I'm like, well, one animal? Like, I didn't quite get it. And so then she says, well, I never had this problem until after I gave birth. And I'm like, oh, okay, now I see it. Now I can help you. If you have one animal issue and that's the only thing you have, then, I'm not sure you really need a massive overhaul of your immune system. But that's exactly right. If you change your hormone, and some people say, oh yeah, after my third baby, I couldn't lose the weight. Or after my first baby or 25th baby, I couldn't do this, or this happened. Those are physiologic changes. That's not you. That's not how you're destined to be. That's how your physiology has learned, because the learning keeps occurring throughout your life. The immunologic learning keeps occurring. And so there's an intimate connection between hormones and your immune system, absolutely. And vitamin D, somebody mentioned something about thyroid, vitamin D. You know what? Vitamin D is also a major regulator. I had, vitamin D levels drop when progesterone drops. Whenever, these hormones work together. They all come from cholesterol, and so they're going to work together in lieu. If you see a man who's okay, if there's a man whose erections don't work anymore, you find low testosterone, guess what? You're going to find all kinds of hormone imbalances. It's not just one hormone decides to plummet. It's because your body's shifting its priorities to make more cortisol and make less of these hormones like thyroid, vitamin D, progesterone. And all of these things are it's like a shunting, a reprioritization of what your immune system needs to do. So you give somebody these immune stabilizing hormones like progesterone and vitamin D, you're going to see a world of a difference. That's why if you work on the physiology, you don't need birth control for menstrual symptoms or premenstrual symptoms. Or you don't need medications. You don't need like heavy Motrin and stuff like that if you're having heavy menstrual cramps. You can make fibroids go away, and make somebody's fertility come back by the fibroid going away without having the uterus cut out. So if you understand how hormones work, and a lot of doctors don't, they just scared, oh, hormones, breast cancer, and then they stop thinking about it. But yeah, vitamin D is excellent. You can do a lot with it. Iodine, you got to be careful. You can shut off your thyroid if you overdo the iodine. Now, there'd be naturopaths that'll say, no, use iodine, but there's mechanisms. This is not an opinion. There's just mechanisms that's publicly available. You can Google this. There's a limit to how much iodine your thyroid can take up, and if you exceed that, it'll send signals that tell your brain to tell your thyroid to not make so much thyroid hormone. So, outside of iodine deficiency, which I don't see very much, you can balance thyroid without using iodine.
I agree with you, DV. I think think you can actually push yourself into hyperthyroid also, and then cause a crash later on if you take too much iodine. Yeah. It's super, super important to not overdose iodine. Somebody asked about menopause and black cohosh only worked temporarily. Speaking from the herbalist point of view, everything DV said, also I would support also in conjunction with herbs. And one of my favorite herbs to work with people who are at fluctuating times with their hormones, like say you just had a baby and your hormones are starting to rebalance, or you're trying to get off the birth control, chemical birth control, and your hormones are working to rebalance, or during menopause when there's a lot of fluctuations in your hormones. One of my favorite herbs to work with is Vitex. Vitex agnus castus, and that's really great, working from the pituitary level through the endocrine system, along with the vitamin D, like DB was talking about, and of course working with the microbiome too. But Vitex usually works for most constitutional types at those times when your hormones are fluctuating. And that might be why black cohosh wasn't working. Black cohosh works a little bit differently with the hormones, endocrine system. Actually, traditionally, black cohosh was an herb that was just used as a pain reliever. And it was just for systemic musculoskeletal pain. But in modern usage has moved it towards as what they call the menopause herb. I don't think of that as a menopause herb, but it can be helpful in some people. Usually it's short-lived though. You have to work in formulation with other herbs to help work to balance when you have those fluctuating times in a woman's body, in a woman's life.
Thank you, Colleen. Can you come back onto the camera so we can see you?
Oh, I just would rather look at the food.
You're on spotlight. We're looking at your plates. We just want to eat your food now and drink your tea.
Talked about astragalus. I wanted to show what Devi is talking about. I have some of the astragalus root here. It's an amazing plant.
And where did you order that, or is that something you found outside?
I did order it. Now this is actually a legume, so it does grow in this area. If somebody has an area like sandy, kind of loamy soil, if you want to grow some astragalus, you can grow it in your yard. It does grow here, but I purchased this from Frontier Herbs.
And so we have a question about y'all gonna have a whole business if y'all listen to everybody, because they want classes on cooking, fibroids, like all kinds of stuff. So Takitha's asking about a safe dose of progesterone, and Sherry wants to know about sea moss. Is it good for balancing iodine?
So progesterone, all hormones need to be dosed to the person, and it has to be customized. So it's all person to person. It depends on your estrogen levels. It's really about the balance between progesterone and estrogen. So obviously, if somebody's gut microbiome is such that they don't poop out estrogen when they have a bowel movement, that estrogen stays in the body, then they need more progesterone than someone who doesn't have that problem. So dosing is all customized to each individual person's unique needs.
Amen.
And what about sea moss? So there are two things that don't directly have to do with allergies I'm interested in discussing. One, we have a lot of people who are taking sea moss. There's a huge market for sea moss gel right now. People are taking it to boost their immune system for COVID. And then also there's people on both sides of the fence for the help me out here, for the shot, for the
vaccine.
For the vaccine. Thank you, Ms. Wajia. There are people who are like, I refuse to take the vaccine, blah, 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 blah. Also, people will say, well, if you had COVID, why you need to have the vaccine. So can you guys please speak on, I know it's two very different but related, the sea moss and the vaccine?
I think that's a huge topic, the whole vaccine thing. Do we really want to get into that now?
Just a little, I know it's tough, but it's something that we.
Yeah, Colleen, why don't you go first on this one?
Yeah.
So I don't feel like I can make that decision for people. I have not gotten the vaccine. I have autoimmune issues and I don't feel comfortable doing that. I have 4 autoimmune, although they're regulated and I'm balanced. I don't feel like I'm going to introduce that to my body, but I am going to be responsible at how I interact with my community because I feel like I have a social responsibility and I may get it later. So I may change my mind about that because I do feel a huge social responsibility. I had a different opinion about my vaccines when I had children when they were younger. I also was on the very conservative side about giving my children vaccines. I was not wanting to introduce those to my children when they were so young. So I do have a philosophical belief about vaccines, but I'm not an anti-vaxxer. I just think it depends on the person. And I think there's a social responsibility. So if you're not going to do it, you have to be socially responsible about how you interact with the rest of the world. And how you tend to your own health, because you're responsible for your health, then that you need to make sure you're protecting yourself and also protecting those people around you. That's my opinion about that. It's very vague, I know, but that's just
fine.
I can't make that decision for anybody else.
Yeah, that's really good. So, Colleen and I work with individuals, and we'll do classes and stuff, but it's individualized sort of healthcare, whether it's herbalist, naturopathic, or allopathic like me. And so that's one-on-one, right? The vaccine discussion is a public health decision. It's for public. So it means it's really aimed at the whole society. So if a couple people here and there die from it, then or get sick from it, doesn't really matter from the public health perspective. I'm not saying it doesn't matter from my perspective or from Anthony Fauci or whatever, his perspective. It's just that's just kind of the game. If you're a public health person, you're focused on the health of the public, not the person. And it's kind of like when you look at communities, and then it's not the same thing as individuals. So number one is that you got to see that there's different priorities for that. And in that sense, you can have two opposite opinions at the same time. You can think, well, maybe for this particular person, it may not be the right decision. Like Colleen was saying with her immune system, it's not something that would be a good decision, but while at the same time saying, yeah, it's a good thing for the public to have. We all need to have that kind of nuance in thinking, because the either or of, oh, I don't trust what they're doing, it's all like, conspiracy or whatever, I don't trust it. That's still fear-based thinking, right?
Yes.
Or if you are like so scared of COVID and you're such a herd mentality that you take the vaccine just unthinkingly, that's also acting based on fear. So tell me what human decisions are well done when coming from fear or anxiety or anger or bitterness or hostility, right? All of these emotions and states of being are by definition erroneous ways of perceiving. You're only going to get incorrect information and incorrect sequence of concepts in your mind when you enter any discussion from these perspectives. Okay.
I love that,
So,
DB. That's so perfectly said.
thank you.
I love
Thank
it.
you. And so this decision should be calm, dispassionate, not emotional. And it needs to be for all of us that are interested in a personalized decision for ourselves. They can make that decision for themselves. Telling other people what they think they should do is kind of aggressive, right? But we live in a very aggressive society, right? Let's just be clear about that, right? So everybody's giving their opinions, and trust me, if you're a doctor and you come out anti-COVID vaccine, you're going to get spotlighted and you'll get canceled. Yeah. And I'm not saying that I care what people. You can't not care what people think, So there's a role in which you kind of have to tote what, as a doctor, I have to, okay, let's say purely from the science, the data for the vaccine is really good. I mean, the 12 blood clots from the Johnson & Johnson vaccine, that there's more blood clots just in the last hour from birth control than than millions of people that got the Johnson & Johnson vaccine. Birth control is still more dangerous than the Johnson & Johnson vaccine from purely that perspective about blood clots, okay? So already people are freaked out about that because of the erroneous thinking. It's like, that's not really the way to think. The Pfizer and Moderna data was really good. If you just look at it as data, really good. From a public health perspective, there's no reason why you shouldn't get it. Number two, I'm not really sure. I've not seen people who had COVID once, recovered from it, had tested negative and all that, and then got it again. So if you got COVID, your personal decision about the vaccine should be different than if you never got COVID at all and you always tested negative. It should be a different decision, type of thing, right? Then what about side effects? Am I seeing side effects? I'm seeing tons of side effects. Now, does it matter in the long run? Are there people that handle it just fine? Yeah, I've got tons of patients that are people that I know, especially people that are not chronically sick, that got the vaccine and they're fine, no big deal. Are there people who are chronically sick, get the vaccine, and they're just feeling worse after that? Yeah. Is that feeling worse life-threatening? Frequently, no, right? Is this on the same level? Is the worry about this vaccine on the same? Is it really catastrophic? I would say at this point, as of today, I would say no. Not on the same level as, if you've ever met anybody that had got MMR and then their child became autistic, you're never going to debate that with a parent who's got an autistic child after MMR. Or if you were a kid in 1978 and they got Guillain-Barré syndrome after getting the swine flu shot, you're going to be horrified. Your heart will break for people like that. Or all of the, or the people all these young girls that got the Gardasil vaccine and now they're paralyzed, right? So it's not something that you want to, those are, I would say, pretty catastrophic. And so are there people that have had really bad, there are deaths, there are people that have died, but it's not going to enter the public sphere because, people don't die from it. They die from the inflammation induced by it. So you can't, just like with mercury and vaccines, right? So you can say that mercury is associated with autism, and you can say that vaccines are associated with mercury, but you can't say that vaccines are associated with autism. You see that? So the word choices are all like, that's how they get you, because we live in a society, let's just be calm and accept the fact that we live in a society that's controlled by the power players. It's been like that for 2,000 years. It's just a routine, calm, dispassionate understanding of history will really reveal that the puppeteers are there, right? And they convince us of things and let that be there. So it's on the onus upon all of us to lovingly, right, kindly to ourselves and to the people around us, to be as educated as possible, non-histrionic as possible, right, and make the best decision for ourselves with the information we have, right? And if we have new information tomorrow, we just learn. We're learning just like our immune systems. That's all, right? And like there's the reality is that this is a pretty crazy situation. There's a lot of confusing stuff. I know people that test positive, but they're not infectious. So if they cough on you, you're not going to get it, even though they test positive. How do you explain that? Oh yeah, the testing will pick up dead particles, or all kinds of theories about that, right? So there's a lot of confusing stuff. There's people who will get COVID and then be chronically fatigued and sick for months after, and they'll test negative for COVID, right? So, but what we do know is that whether we're talking about COVID or EBV or syphilis, microbes, if you change the microbes in the human body, you'll change your immune system. And that change in the immune system will either be beneficial, not beneficial, or neutral. Now, most things don't stay neutral for a long time because everything's moving, everything's fluctuating in nature, right? So everything will move ultimately towards beneficial or not beneficial. If it's beneficial, then you think you're good, and you think that your narrative of being benefited by it is something that everybody should understand, and you want to take your microphone and scream it to everybody. It's your truth. That's your truth, baby. It's your truth, right? Now, if you had a bad experience, it's your bad experience, and that's something that the onus is upon you to learn from. Yeah, do you want to get on the public and megaphone and scream out to everybody your experience so that they don't go through what you went through? Yeah, there's a role for that. There's a role for the Facebook groups of people that are, want to spread the information about danger, don't do this, etc., etc. But I still worry about the type of thinking where we're dominated by fear, anxiety, paranoia, because these things don't serve the individual, they don't serve societies, they don't serve communities. And so, like, take the information, take the emotions out of it, and stick to just love and compassion as your emotions, and then make the decisions. Okay, and I think you'll be fine.
I agree with the. I'm sorry. Go ahead, DB. I was going to say, I agree with that, but I also feel like the polarization of do it or don't do it is limiting in the conversation. Like DB said, there's nuances. And I feel like, what's a public health crisis? Food deserts. Why aren't we up in arms about that? I mean, people need to have access to good food to be healthy. So I feel like, some of these might get the vaccine, but they're still not going to continue to take care of their health. I mean, I feel like we need to broaden the conversation about what public health is. Obviously, we're in the middle of a huge crisis, the pandemic. And so people aren't going to want to talk about that. They're talking about this. But I feel like when we get into these polarizations, it's division. And like DB said, all these strong emotions of for or against. But we don't have the nuanced conversations, which is important to what promotes health for the whole planet. And not just for humans and not just for wealthy white people who have access to Whole Foods and moms and getting all the supplements and all the fitness, personal instruction or personal trainers kind of thing. Anyway,
exactly.
It limits the conversation.
Exactly. And there's the nuance that her and I are saying is that, if you have an altered immune system, put a little thought into it.
Yeah.
If you want to be part of the public health effort to get rid of this disease, and that's part of your thinking, take the vaccine, move forward. That's okay too. But you just have, you have to do it for yourself. But there is a lot of unknowns. Okay. So when you enter into anything unknown, Like, think about if a person enters a movie theater in Aurora a couple years ago to watch Batman, and then they get shot, right? It's like you think you're doing something safe, right? But then you get shot, right? This has happened. It happens in schools, happens too much. If you are African American, apparently you can get shot for no reason. And anyway, so the unknown is there. It's anxiety provoking. So does that mean we avoid movie theaters completely? Do we? No, right? Do we avoid cops completely? Yes. Okay, so there's some exceptions to that. But the my point is, though, we have to accept a certain degree of unknown, of uncertainty, right? We don't know how anyone's necessarily going to respond long term. We don't know much. This technology is new. Somebody mentioned that mRNA vaccines are brand new. They've never been used before. Moderna, and I remember hearing about Moderna like in April of last year, a year ago. So they were on the tip even at the beginning, right? So there's a lot of unknowns here. So that's also something that what does unknown and insecurity do? It actually feeds anxiety, right? So we need to temper that. We need to remember that. And if you don't know, it's okay to not know. To say I don't know is okay. And then if you need to delay your decision, that's okay too. All right. Being panicked is just not a great idea. Are there people out there that they want to just go out and get the shot? Like all those, the presidents, all the ex-presidents got together and they did that. Yeah. They want everyone to do that. It's fair. Why debate that, right? And so we just got to think clearly and dispassionately about this and try to avoid extremism, especially when dealing with each other, because we're just dumping all the semi-accurate thoughts that we have on others. That's not fair. And our loved ones don't deserve it.
Yes.
Thank you for that. So
still want to talk about Irish moss, sea moss?
That's right. The sea moss. There's an explosion of sea moss, and so like Colleen said earlier, that if you have a certain constitution, you need to know what you're taking. You just can't take something just because it's good for something. I said to Colleen the other day, yeah, I'm taking turmeric and black pepper tea, and she was like, why?
Yeah.
And then, so yeah, please talk about that.
I think Irish sea moss is nourishing and building for dry, inflamed, deficient people. If you have, thyroid issues, I'd use caution because it is high in iodine. I don't use a lot of seaweeds because of that. I have hypo and hyperthyroid. I mean, I'm very balanced, but I watch what I bring in. Like Devi and I've been saying, it depends on the person. There is no panacea except for basic common sense about health. That's the best way to protect yourself, is to have, eat well, rest, get good sleep. Sleep is like primary medicine, and move in a healthy way. Doesn't mean you go out and work out really hard, but having said that, Irish sea moss is full of minerals, but it just depends on your constitution, how much you take, or if you take it on a regular basis. If it feels right for your body and you're not having, pay attention to your body. If you start feeling jittery, you're starting to drop weight too quickly, you stop taking it, or maybe you need a lower dose or something. So listen to your body.
So Colleen, do you recommend that, before people, do you think that if somebody goes and just reads a book or, listens to what you say and take really good notes, and they just, take all your suggestions and take all the different herbs because they feel like they identify with that, what do you think about that as, as far as like approaching herbs and healing yourself? What do you have to say about that?
So I believe that you can, herbs rarely really cause direct harm, but they can harm in what I think of as an indirect way. If you're not taking the right medicine for your constitution in the right dose, you're not getting the help your body needs as quickly as you could. And that's why I think having a guide help you is important. And then you'll have that person guide you, just like you're learning anything. You have somebody who has some training in it, and it helps you understand your body better and understand the plants within your body. So I think that's the best way to do it personally. As a person who practiced on my own body for a long time before I studied, and I know I caused, I could have gotten help sooner if I went to a practitioner. And I think it's a relationship you develop with a person. 1 or 2 visits isn't enough. I tell people I love working with people with autoimmune and with complex issues, COPD, high blood pressure, autoimmune stuff, but it takes 6 months. I think if we can work together 6 months pretty consistently, then we'll know if this is going to work. We'll know your body, and even longer, because we'll know your body through the seasons. So maybe you come in for a consultation and then we see each other every 4 to 6 weeks for the first 2 or 3 months. And then after that, it's, we spread out the consults, and then maybe just once a season or twice a year, you come as you get your body back in balance, and you learn more about your body throughout the seasons and what works for you and doesn't work for you.
So, what is the best way to start a relationship with an herbalist?
With an herbalist? Well, with me, you can email me, colleenzuntage@gmail.com. But also there are other herbalists that have specialties, and you can go to the American Herbalist Guild website and find, they have a listing of all kinds of herbalists there around the country that all have their services that they can work with people. So that's another way to do it.
So is there a difference between a clinical herbalist and another kind of herbalist? Why are you considered a clinical herbalist?
So herbalism is not regulated in the United States. Some countries like Australia do have licensure for herbalism, but in the United States, there is no licensure. So I would make sure the person has gone through a reputable school and that they or trained with somebody. Maybe they've apprenticed with somebody, a well-known herbalist, or they don't even have to be well-known, but an experienced herbalist. I'm a clinical herbalist because I took training and I learned the materia medica and the pathophysiology and some anatomy physiology of the body and then also I had clinical experience as part of my training. So I was in a supervised clinic. My teacher, my mentor, she's been practicing herbalism for 40 years. She was a nurse for 30 years also, maybe even longer. She's still a nurse, but not practicing. And she also has a master's in public health. So that was my mentor. And I also trained with KP Khalsa for my first year, but I had a supervised clinical experience in my training.
So Sherry is asking, and based on what you're saying, we already have a half an answer to this, but what's a good path to take for proper training on herbs? And do you have to start with having a medical background, like schools and classes?
So it depends on where you are. You do not have to have a medical background, but it does help to understand the systems of the body. And you can learn that. You'll learn that while you're studying herbalism. So you can go to an herbal school. We had like the Mid-Atlantic School of Herbalism. I don't like to self-promote, but there is a school. Here. I know. I want to promote plants. I want to promote the plants. Mid-Atlantic School of Herbalism, we're a 2-year certificate program. We do have clinical rotation in the 2nd year. But also, if you want a master's degree in herbalism, you can go to Maryland University of Integrative Health. So there's different spectrums on how you can get your training. That costs like, I think, $65,000. We're definitely not that expensive, but it's a master's degree in herbalism. They don't have a clinical component though. We are the only school in the area that has clinical training for their herbalists.
So, Selena, I can answer this question, Selena. Selena is asking if you recommend achieving a vegan diet before seeking a consultation with DB or Colleen. I think I need to start there as a foundation to healing and better health. Honestly, Selena, I'm vegan. A lot of my students are vegan, but it's not for everybody. It's not a requirement. If you're interested in working with one of these two amazing, knowledgeable people, you can click on their information ASAP and make an appointment as soon as possible, because they're going to help you, and you don't have to be vegan to get help from these two. Most of their people that they interact with are not. That's not a requirement at all.
You don't have to.
No.
I like to eat seasonally, and for your constitution, that's what I recommend. Seasonally through the year for nature, but also seasonally where your body is. I mean, if you're depending on your age or where you are in your life cycle and what your body needs. So that's what I recommend.
So Dee, how do we? I'm sorry. Yeah.
Yeah. In my case, the process for us is that, it's really thorough. It's really detailed. When people meet us, we're going to dig deep and we're going to find the solution, the explanation for every symptom. You know, it's not like, you know, most doctors, you go to them and you get blood testing, oh, you're fine. You feel awful, but you're fine according to the doctor, and you have to leave, right? That's not our system. We're going to figure out exactly what's going on. And so that all that data that we generate will give us treatment plans. And the treatment plans require integration into your lifestyle, and then, you know, like sort of working through them, working with me, give me feedback about them. So we got to make the treatment plans work and be successful. We want to convert a disease physiology into a healthy physiology. And the only way to do that is by a total transformation of your physiology, right? So that commitment that requires, that sort of accountability, you got to do the basics before you, I think people should do the basics before coming to me. Clean up the lifestyle, you know, get rid of toxic stuff, you know, clean up the diet. It doesn't have to be vegan, but get rid of the junk food, you know, stop smoking, right? Try, if you're drinking a lot of alcohol, decrease it. If you're smoking a lot of weed, smoke less of it. You know, cigarettes, I mean, if you're still smoking cigarettes, I don't see why you would go to an integrative medicine doctor. I mean, it's like the elephant in the room, you know? If you have no interest in making lifestyle changes, it's highly unlikely for you to get significant benefit out of us, because, you know, you can't do this without lifestyle changes. There's no way. Americans are not spiritually or culturally or ethnically equipped to be healthy, period. So in light of the fact that we're getting poisoned since birth, and we live with childhood trauma, and we live in a pandemic, and or so much anxiety and so on, we're just not equipped. So at the very minimum, do your own self-care, right? Clean up the lifestyle, optimize the relationships. Maybe if you're coming apart at a memory that occurred 20 years ago, I would, you know, get into that now, you know? And then when you've done everything you possibly can to improve your health, and that will make you feel a lot better. If you don't feel good, that will do a lot to make you feel better. You know, read on your own. You could take some supplements that you feel like have worked. Maybe, you know, use your own mind. I trust it when people use their own mind to make decisions. Do the best you can for yourself. And then if you still have trouble, then come to us. Because then it's like, I can see, oh, this person went gluten-free, they went dairy-free, they started exercising, they went keto, they went this, they went vegan, it didn't help, they went carnivore, it didn't help. They do these things, and that's data, that's information for me that I can use to guide me towards where I want to, how to understand this person. I have to understand each individual person. Like, that's why we're so detailed. 90 minutes per consultation you get with us. Where are you going to get that in any doctor on the planet, right? So, but because you know, insurance partially covers my service, and the rest you have to pay for, right? So that also makes our patient system, that makes it manageable, because you know, I can't spend all my life, like all 24 hours of my day doing patient care, then, you know, it wouldn't work. So we have to have a system that is not cost prohibitive, but also is not like that only insurance billings, because if any doctor that lives on insurance billings alone, they're you know, it's you can't survive, you know, because they don't want to pay anything. So, you know, it is an investment of your time, energy, effort, and money. And for any good integrated medical system, any holistic system is going to be not covered by your insurance, right? So you're going to have to, that's realization. So do the best you can on your own, and then come to a doctor or to a holistic practitioner to help you do the things you can't do on your own. It's kind of like, if you can fix a leaky faucet on your own in your house, you don't need a plumber, right? But do the best. But if you can't, then you call somebody to help you, right? So it's the same thing. We need to get more information about our own bodies and how to be healthy and be less dependent on anxiety-provoking power structures that really don't do much. I mean, they're not going to do much. Like stage 4 cancer patients, they're all getting chemo. They're all going to still die, right? So yeah, being vegan in the American context is not easy unless everyone around you is vegan. That's true. That's absolutely true. And you know, stopping smoking cigarettes is not easy until your partner does too, right? We're communal animals. We're herd animals. We're like we're like cows that eat meat, you know, basically. So we need to nourish this.
I live in a house. I have 3 sons and a husband. My mom lives here too. They all eat meat.
Chicken.
whatever.
Amen.
She's hiding on the
Amen.
side, y'all. She's
I
hiding
live
on
with
the
a
side.
pinky
Come
to
on.
you, child.
Yeah, but look at that. Look at that. Look at the commitment to self-care that you manifest, right? You could be, hanging out with Eskimos and not eat fish. You know what I mean? You got that. So that will, the will to power, the will towards that connects you. That's what's dharma, right? You connect your subconscious and your life energy with your purpose, your external energy, your social interactions. When you connect those two, that's like a stream of pure energy from the deepest part of you to the most superficial part of you. Body and mind connect. And then you're going to be successful at anything you put your mind to, because you'll only put your mind to something that you'll be successful at. Right? We all need to be manifest
My
that.
Zoom call has gone.
Whoops.
It's way over.
I agree with Dee Dee that it is much easier to work with a practitioner if you have done your own work also, but I do believe that herbs can help you do that work. So I do meet people where they are. If you have a lot of anxiety and sometimes you don't feel like you have the ground underneath you to make decisions, to make lifestyle changes, and herbs can work on the nervous system to help you feel calm, more secure, more connected to yourself, to help you make better choices in life. So I do meet people where they are. And like Dee Dee said, it's much easier if you can do your own work, but sometimes you don't have the connection to do that. And herbs can help you connect back to yourself so you can make better choices. So.
And now, first I would like to say that these two are a pure example of nobody feels sold right now, right? Like, I'm like, can y'all please promote your business at all? Like, y'all like, don't come to me until really, okay. So first of all, if you want a support system where people are vegan and people are exercising, whatever, that's what I'm for, right? I have free classes, pay what you can classes. You are welcome to come. They're virtual, accessible, it doesn't matter where you are in the world. As far as having sessions with these two, they're not a wham bam, thank you, ma'am. Colleen's intake is 2 hours. Like DV said, 90 minutes. I can tell you, I've been in, they ask you questions and you're like, huh, really? You want to know all that? So, and really, and Selena with, sugar addictions,
herbs can help with that
getting
too.
rid of stuff. And if you're trying to do it on your own without, say you don't call these two, give up the thing you're ready to give up, right? So maybe you don't give up the sugar addiction right away. Maybe you give up like soda first, maybe you give up, and this could be a longer conversation. You give up the things that you're ready to give up or that you're ready to change. And so,
or you increase something, bring something in
right,
that's more healthful. Maybe you're not ready to give anything up yet. Maybe you start bringing more vegetables in, or more water, or you go to bed earlier,
Right. So, I think DV, you were about to say something.
So that's these are efforts, what Colleen and Michelle are saying about sugar, for example, right? Because you can apply this question to all kinds of habits, right? How do I stop yelling at my wife? That's my problem. No, I'm kidding. Okay, I'm kidding. So any behavior that we want to change, right? We do the efforts we can. We got to ask like people who are in this sort of coaching space or the lifestyle self-care space that Michelle is, in herbalist like Colleen, or medical like me. I mean, there are you take the resources you can, apply them, right? Use your own common sense, and ultimately, if you're not successful, then it means you haven't gotten to the cause. Okay? Phenomenon have causes, and the causes may not always be easy to understand, but they are available, especially medical. It's the human body is beautiful. It's amazing, but it's not mysterious anymore. It's not as mysterious as it used to be. So there are causes for stuff like sugar cravings. For example, I don't know what they are in you, but I can give you the 25 lists that that are there. We have to explore them. So in a medical context, we could get to the underlying causes of that. But I get all kinds of stuff. I get patients that say, oh, you know what? I used to be able to enjoy a glass of wine at night. Now I can't. I get immediately nauseated and I feel hungover. Well, maybe that's a microbiome problem. That's actually very common sign of candida in the intestine, for example. So, or, that's a reason people, come to us. So I really love when people do as much as they can on their own, because that demonstrates self-love and self-kindness, right? Take the resources, build from your community and the people you trust. And then, you know, when the medical stuff is difficult, then I think you should come to us. So we take patients in Columbia, in all over Maryland and all over Southern California. And, you know, they're long consults. We like to do it over video because the discussion can occur over video. And we bring you in for a physical exam. We repair joints. We do PRP and Prolo, IV treatments, IV vitamin C. We do cancer treatments. I got cancer treatments that are safe, that will extend lifespan in people with metastatic cancer. The main IV treatment we do is IV vitamin C, high dose. So we will treat, we will, if you got a complex problem, then, you know, we're a good resource to have. And CCIM like Mary, health, HEALTH.com. You can email us. My assistant will get back to you pretty quickly. The phone number's there, the email, the website, there's tons of blogs, tons of information on there. All the microbiome stuff is on there. I just posted everything that I talked about today. My guy is putting it up on our website right now. So, you know, we'd love to be of service to you, and we will take your existing support structure and include that in our thinking about you. You know, so let's say you're working with Colleen and you want to do a medical thing with us. We're not going to want to get in the way of your relationship with Colleen, for example. Or let's say you're working with a doctor that is, you know, maybe not what we do, and you still want our input. Then I'm not going to shit on the doctor that's doing stuff with you. That's one of the worst things I've ever seen, is when practitioners say negative things about other practitioners, even if they think differently. It's like this polarization we're seeing in the society, and when doctors do that to each other is awful. You know, all these doctors that say negative things about integrative medicine or holistic medicine, these people are like stuck in the 70s or 80s. You know, it's the 70s minus the Quaaludes. They're like out of it, totally out of it. You know, and so you know, that's where we'll take into account what your life is, what you're in, and help you fill in the gaps of what you can't do on your own, right? Because a lot of people, I want people to know that there is a ability. It's in anyone's capacity if they're conscious, which means if they're conscious, they're alive. Okay. I mean, there's some people in a vegetative state. I'm not talking about them right now, but if you're conscious, you can heal. Okay, and no matter how bad your problem is, there is some ability to heal there. It may not always. I mean, if you're at the end of your life, then you can heal a lot of things. You may not be able to save your body if you're at the end of your life, but there's still a lot of healing that can happen, right? So there is a solution for healing for everybody. Okay, doesn't mean that I'm the source of it, but it's there because that's the miracle of the human experience.
Yeah, I love that. And I think healing is different from curing. I mean, I think the process of getting to know your body and getting to know how you live in the world and how your inputs affect you and how you assimilate life, that's healing. And so, you know, it might be something then you start having to manage your health differently, and you manage your life and you make changes and get to know yourself. And DV's mentioned many times self-love, which love is the ultimate healer. And that is that's the path. And I think if you try to shortchange yourself and try to get quick fixes, you miss that opportunity to get to know yourself and go deeper and get to the layers underneath everything. And then I feel like that heals the next generation. And I feel, you know, previous generational wounds can also be healed if you do your own work and go through this process. So not saying that, you know, sometimes we want a quick fix, you know, the allergies are killing us, you know, but then getting to the underlying cause, that is, you know, that can really move forward and back in history of your family line, I believe. So you talk, you know, family constellations and things, doing your own work. I feel like we're losing people because we're going on.
So the three of us are the kind of people that will hang tight all night and then be like, "Are y'all hungry again?"
I'm like, I don't want to eat all this by myself.
So
I'm not ready to dig into this horseradish here.
Awesome. Yes. So, and then Dee's family is probably wondering what he's doing.
Yeah.
He's going to eat dinner right about now. It's 6 o'clock in LA.
Exactly.
So
thank you so much, Dee, for giving so much of your time tonight.
Thank you guys. Appreciate you both and everybody here.
Yes.
What's up, Eula?
So thank you all for coming. Thank you for being a part of this. This is recorded. And so, and my services, I basically what I do is I teach yoga. I do some life coaching. Is based around the yogic philosophy. I also train people with strength training, and I do a method called the Feldenkrais method, which is a hands-on healing modality that helps to decrease pain, physical, emotional pain. I'm trying to like squeeze it all into a thing, but y'all know my website because you registered for this class. Just go to my website.
Oh, the yoni work, the yoni work.
Oh, y'all see my yoni eggs back here? Is that Tosh?
That's how Michelle and I met, in a yoni class. Yoni egg
There's
class.
some yoni eggs here. I do teach people how to use yoni eggs. And this is not just about making your yoni tight. Actually, that's a bad thing if it's tight. It's connecting with it in a healthy way, making the muscles supple and functional. And it can also potentially help with back pain, believe it or not, which is a big thing for me because I suffer from chronic back pain if I don't do all these moving things. And so, yeah, the base of what I do is to help people get out of pain. And that's why I call Colleen and DV in, because the physical pain, you know, the emotional, spiritual stuff, but these guys are experts on the more medical part, the herbal healing and the, you know, wisdom that goes beyond. And together, like DB was saying, like we can all work together. We all are good at something and we share our gifts and we honor them. So because, you know, y'all all feel like family, even those of you who don't have your camera on, we love you anyway. So see you next time. Oh, Regina came on. What up, Regina? Yeah. So the family reunion will be this summer. Oh, SI pain. Yeah, Selena.
Oh,
Connect
yeah.
with me. Oh, hey, little one.
This is my 4-year-old.
Aw.
Say hi.
Hi.
Hi. Yeah.
Such a big boy now.
Yes.
So cute.
Hi. Aw. Oh, I see another little one. Sherry's got.
Yeah, Sherry's got
a little one too. Teaching them young, that's so great. Oh my goodness, my kids first exposed to herbs when they were touched the nettle that was grown in my backyard. They all came in with rashes on their arms. They were fighting. I was so excited. Yay, we have nettles. And my poor kids. Herbal mom.
My daddy.
I know, babe. Hold on 1 second.
Oh, yeah. So y'all stay in touch.
Oh, okay.
Take care of yourselves.
Thank you, everybody. Thanks for showing up. Thank you, Michelle, for organizing this. Thank you so much.
Yes, I'll say to you what I say to my yoga class. Y'all know. Thank you for showing up for yourselves and for each other, because it really does make a difference.
Yes,
it does.
Y'all.
Makes a difference.
Thank you, Michelle. Appreciate
Thank
you.
you, Michelle. Thank you,
Thank
Davey. Thank you,
you.
everybody, for showing up. Have a good night.
Bye, guys.
Be well.
Thank you so
Bye.
much. Bye-bye.
Bye.